So you're going to edit out like things that might need to be edited out.
Yes. Yeah.
Okay.
Including full sections. So like as we're
Okay.
going through the quotes, or if like somehow something about your personal life comes up and you're driving home and you're thinking like, David, could we take out that section about X? It's gone. So just
Cool.
let me know.
Okay.
Yeah. I'll make you sound good. I promise.
Appreciate it.
All right, cool. Ready?
Yeah.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
All right, everyone. Welcome back to another night of David's Saturday Night Sit Back. Tonight on the show, we have Beth. She is my dental hygienist. She is also, though, a baseball player, a scooter rider, a quote poster, and one of her life goals, I believe, is that you will one day have a yard full of sunflowers. Has that one come true yet?
Not yet, but we're getting there.
Okay.
I don't know how the Texas climate agrees with sunflowers. Probably pretty decent, but that was back home for me. So there's this beautiful farm, kind of in like the little valley, like Central Valley in Connecticut. That farm draws so many people just to see these sunflowers. It's super big. It's beautiful.
My mom would love that. She loves sunflowers, so whenever I buy her
Gorgeous.
flowers or even just sunflower-related stuff, flower pots, or yeah.
It's a thing. I don't know. I think they just bring happiness. They're a different kind of thing. I also like that they tilt their head to the sun.
Yeah.
I don't know. All the plants respond that way, but they're different.
Have you been to the Far West Dog Park? Mm-mm. It's technically not. It is a dog park, but there's a ton of people there that are just walking. And I took a picture today for the family because they have. So here's one flower,
Oh yeah. Oh, black-eyed Susan.
but they have. It's just a field
Oh,
full of
cool.
those in between the paths, and yeah,
love it.
it's just a really pretty dog park. I wish there was more dogs at the dog park, but he likes it whether it's just us or a bunch of dogs. So
And it's good scenery,
yeah.
so that's always good.
Okay,
I love that.
I have to ask you about your name
Okay.
because do you watch Yellowstone?
No. I've heard.
You don't have to for this question. I thought it was awesome that your first name is Beth, which when I've met Beths in the past, my own sister's name is Beth. I don't think of Beth Dutton, if you happen to know who that is. She's a character from the show. But in real life, her brother in the show, his name is Luke Grimes.
Oh, that's funny.
And your name is Beth Grimes. So as soon as we added each other on Instagram, it's like, oh, a little ding, ding, ding for Yellowstone
See, I
here.
thought you were going like Rick Grimes. I'm like, oh, you have like such a TV name, but
No, just
Yellowstone.
like well, and because they're siblings, and her first name is, I don't know the whole thing. It's just my crazy little
The
head
connection of it.
putting useless connections together.
very recently someone was like, you remind me of Beth, and then from Yellowstone, and then someone else was like, that's a bad thing, and then they were like, no, it's not, and I'm like, I don't know.
Beth is, one interview put it perfectly when they introduced her, but they said she is, on one hand, like America's sweetheart, but on the other hand, she's also a murderer, and she is basically straight up evil. And so that if you did watch the show, I was going to ask you what your hot take was. Is she the good guy? Because we all root for her. We all
Yeah.
want her to win. But if you really sit back and think about what she's doing, you're like, huh. She is a terrible human being. So,
But does she have reason behind what she's doing? Is she doing it for like family or?
everything's for her family.
Yeah.
Her sort of theory, she even says it in one episode. It's you love those, the people you love them with everything you have, and everything else is just a distraction and should be destroyed.
See, that's relatable. I can get on board with that.
So if your friend was saying it in the sense of like you're very loving towards your family, your friends,
Maybe.
that would be very Bethish.
Yeah.
Or maybe you're doing something really bad. Were you killing someone?
There's always duality. I'm not gonna, on air say that we've gone that far.
There's skeletons in
There's
your
always
closet.
duality.
Right. But no, she's a badass at the end of the day.
That's how she was described, and I was like, well, that's relatable. Maybe.
I admire her. I even have I have like 8 or 9 quotes all related to sort of things just to motivate me as to why I'm doing the podcast and
Cool.
the ethics of how I want to conduct myself. And one of them is a Beth Dutton quote. So
Cool. Hey,
take that for what you will.
stay motivated.
Yeah.
There's always inspiration, no matter who it's coming from.
Exactly. You had a couple of pictures of Lola the mouse and Molly the dog. So I'm assuming you're a pet person.
I like pets. I like all animals. I didn't grow up having a lot of them. I had guinea pigs in 5th grade that had babies, and that was like the highlight of my pet having time. Lola was a sophomore year of college desire for a pet, and then I found out that gerbils are nocturnal. And I'm a really heavy sleeper, so it was actually my roommate who let me know that they are nocturnal, and so Lola had a quick exit. But she was cute while she lasted. Molly she was my mom's loving dog. It was the only dog I've ever had as part of my family. We got her when I was a junior in high school. Poodles are too smart for their own good. And as our first family dog, she was not trained optimally, but I love her always. But Molly was a brat. Molly was a big brat, but I love her. I do love animals, all of them. I feel like sometimes we have a language. Like those snakes on 6th. I spoke to one of them. I don't know what happened, but all of a sudden, like, he was just like at me.
Wait.
He was just kind of like, I don't know, we locked eyes and he was just like coming towards me, like all wiggly, and I just like put my hand out and he just kind of, did his thing, and then it was time to go. So I was like, okay, bye, gotta go.
Who are the snakes on 6?
There's this, I don't think it's very animal friendly sort of thing, but there's usually a yellow snake and a more typical boa constrictor. They're very large. They've got to be like 6-8 feet, and you pay money and you can hold it for 5 minutes.
Sure.
Take pictures, whatever. But yeah, there's just snakes in a box on 6.
I haven't heard of that yet. We did go see in February, a friend came out from California and we did the bat bridge thing. And there wasn't that many, but someone else was telling us that we were super early and it's better to go. I think they said April through August or something like that. But he was in town, so we were just like
we're going to do it.
We're just going to go. And we did see some, and it was pretty cool because we had never seen something like that before.
It's really awesome. They apparently, it's because of the way they've built under the bridges and the underpasses. It's like the perfect little nook for them to get in. So back in the day, it used to be like crazy, where they'd like all flood out in this massive way. And then slowly, as more underpasses and everything, I think it's less now because they have more places to live. But it's still cool.
The dog, I think he picked up on their frequency, like on their chirping, because he acted really normal until we walked under the bridge, and then his tail immediately went down and he went into his scared mode, which he usually only does with fireworks or when I'm about to spank him. No other time. And I thought, oh, this is very strange. And then as soon as we got out from underneath the bridge on the other side, his tail went back up and he started doing his happy walk again.
It's so interesting, like the frequency of the sonar.
Right, but it had to be underneath the bridge. Even when we were walking up to it, he didn't really seem to. But there is an echo effect of some sort, I guess.
So interesting. I always wonder how they perceive things. Like, you have this sense that we don't have. Yeah. Their ears, their smell.
Last question for you before we get into dental stuff. I'm assuming that like anyone that works in a dentist office is still normal in the sense of like you still probably eat sweets or consume things that aren't like necessarily good for your teeth necessarily.
Sure.
And there's a couple posts that you had of like cupcakes or whatnot. And I was curious if you've been to the Yard Milkshake Bar.
I have not.
Do you know what it is?
I've heard of it.
Have you seen pictures?
No. Are there things where it's like donut inside of a... Yeah.
It's just these like, come on, flip upside down, little guy.
Yeah, no.
There we
Okay,
go.
yeah. Those are like... See, I'm the type of person that I'm like, these Instagrammable places are like...
These Instagrammable places.
like, it makes me not want to go.
I didn't even think about taking a picture of it. I'd probably have ice cream maybe like twice or 3 times a year. I enjoy the hell out of it. And that
cream's
to
great.
me, that just looks like the perfect way to spend it's hot, it's summertime. Let's go get some ice cream
Totally.
from that place.
Totally. I grew up doing lots of like homemade ice cream, so that would be like my fix. Is like going like we would go to a farm that sourced the dairy right there. Like that is my I forget what it's called. This place.
Yard house.
My yard house.
What is it called? I don't want to misquote them. The Yard Milkshake Bar.
The yard milkshake. Exactly.
Growing up, we did make ice cream a few times as kids, and it was the best ice cream. It almost came out more like soft serve, sort of, and it was
Very creamy.
yeah,
Delicious.
so good.
Yeah. It's so much better to me because I would eat that and I feel like I would be sick. Whereas with this stuff, not so much.
You do feel I never even
Like a
thought
little,
about
like,
that. You're a little less guilty, or not guilty. Like just the stomach baby is
Bloating,
not
yes.
as intense.
Exactly. So I want to enjoy and then not feel completely terrible.
Exactly. I'm going to tell you something I don't know that I've told anyone except maybe like my mom.
Secrets.
I hate the dentist.
You do?
But it's a necessary evil because I'm so scared of my teeth getting yellow and decrepit and falling out, so I force myself to get in there.
I wouldn't have guessed that you hated it.
I get terrified that someday
That's wrong.
someone's gonna be having a bad day and they're gonna like stab me in the neck with their teeth cleaning device to get their rage out, or even just make a mistake and give me a shot and it was supposed to be like something to numb the pain and instead they were like, oh whoops, gave you something
You're the
else.
wrong
Like
one.
I don't know. Maybe because I can't see what you're doing, but I really don't. I get so uncomfortable.
There's a large portion of trust that's involved at the dentist, and a lot of people, like, it actually surprises me how many people are very open and very comfortable and just like they'll tell you their life story. And then also how many people are like, I hate it here. It's not personal, but I really hate it here. And I'm lucky I get in once a year because that's how bad it is for me. It's crippling anxiety. I had someone who had a panic attack the other day. Yeah.
Poor guy,
and
gal.
I was just like, you know what? Whatever I can do to make this easier for you. I was done. I was like, all right, I'm just going to floss, whatever. He was like, honestly, I'm good. And I was like, okay, no problem. Let's get you out of here. So yeah, we see it all. And
The flossing is where he drew the line.
He was like, no, like, I can do that. He's like, you did your cleaning. I'm good. I'll do that at home.
One of the scariest moments in the dentist was when I was getting a filling, and he told me, I can numb you, but I don't think you need it. It's a straight shot. And I was like, I don't even know what that means. It's a straight
just
shot.
like,
I don't
okay,
even know
I
what a
trust
filling
you.
is. And I was like, well, I think I want the shot because I've had those before. And it is it's a quick sting and then it goes away.
Yeah.
So I'm thinking I'm going with the devil I know versus the devil I don't, or the pain I know versus the pain I don't.
Sure.
He convinced me not to. It wasn't that bad.
Really?
It was fine. It was great. And that's part of the reason I've been with them for years is because I've never experienced anything painful there.
And that is another kind of motivator or something that keeps people from going is the fear of the pain. The fear of like not knowing what's going to happen in the next 5 minutes of like, well, I'm doing fine now, but like, I don't know, there's that spot in the back.
Yeah.
Pain is always something that they very much emphasize in school of like, make sure people are comfortable, make sure they're, take care of that. Yeah.
So with that being said, I could never even conceive how one would want to go to school and then do what you do. So how did this happen, Beth? How did you become a dental hygienist?
It wasn't a straight road. It was very windy, and honestly, sometimes I still question how I got here. I went to school for education. And even doing that, I was like filling out. I went to school for softball, was like the reason that I was like, oh, I'm going to go here, was to play softball. And then I'm like, applying to that school. I'm like, oh, what do I want to major in? I'm like reading the options. I'm like, none of these. I'm like, so I chose education as like, well, this is the only one that I could maybe possibly,
Yeah.
I guess. So I did that, graduated. I ended up transferring, and that was kind of a mess. So my advisor, she was like, you can graduate with your class, do that. And I was like, yes, I want to graduate with my class. And she's like, okay, so you'll come back next year. You'll finish up like the student teaching and all of that stuff. Graduated. Then decided, this is not what I want to do. I don't want to do this, just because education is a whole mess. So I was just working for a couple years, like working in a restaurant, making decent money, like paying my rent, no problem. And so I'm like, okay, well, but I don't want to do this forever because this is not fun long term.
Right.
So I was like, okay, what am I going to do? I'm not going to go back to 4-year school because I don't have 4 years. I was like, I need a 2-year program. Looked at all the 2-year program options. The only thing I could see myself doing was dental hygiene. I'm like, oh, I like to clean.
I want
like,
to see this list where that was the only option.
It was the only one that I was
what
like,
was on this
that's
list.
the one.
That's awesome.
So I moved back to Connecticut. I started doing my science prereqs. Because I avoided science like the plague. I hated science.
Same.
My dad, when I was in high school, he's like, go into nursing. It's a 4-year thing. You get a job. You're always needed. I was like, ugh, science, no. And then I ended up going. So I had to take all my science classes. I did that in a year, which was pretty accelerated. And then 2-year program, got out in 3.
Huzzah.
Not looking back, yeah.
Now, how long have you been working as a hygienist at this point?
Only about a year and a half.
Oh, you're really good at what you do.
Oh, thank you. I appreciate that.
At 18 months in, do you feel pretty confident in what you do? Were there ever times, especially, I'm thinking back on like day one, where you were just terrified of like, oh man, don't cut someone on accident, or is that just all my fear that I'm projecting on you?
No, it definitely was there. Thankfully, when I started temping. So I worked in a bunch of different offices all at once. So it kind of relieved a little bit of the pressure of like, oh, if you mess up, like this is your office. If I messed up, it's like, okay, well, see you never. So like, sorry about that, but I don't have to face you again. And actually, funny enough, I never flossed anyone while I was in school. I was like, oh, skip that step. Like, I just did all that. So flossing people was really difficult. It is a lot harder than it sounds like it would be. It took me like 10 minutes to floss someone.
And how fast do you do it now?
Oh, like
a minute or two?
A minute or less, yeah. Yeah. But yeah, I mean, the more you do all of it, the faster you get. There have definitely been times where I've been like picking at a filling that I thought was tartar for me to remove. And, it's just things like that where the more you're like, okay, no, that's a filling, like,
Yeah.
But sometimes fillings go too far over. So it's kind of the dentist's fault, not mine, but.
That's awesome. Well, let's jump into it. We will get, I promise, to some disgusting stories of people who did not take care of their teeth. But before we get quite there, I have some fact or fictions for you.
Okay.
Number 1. The average woman smiles 62 times per day, while the average man smiles 8 times per day.
That sounds really sad, but it's probably fact.
Why do you think so?
Women are more like forthgiving of their or also a lot of women do things because they feel badly, like, oh, like, and so they'll give this like fake emotion even if it's not genuine, whereas I feel like men will not do that, but that's more like psychological.
Right. I know that one didn't have much to do with dentistry, but I was combing through about 30 or 40 and I wanted to pick out just a few for you. And that one just made me sort of think, And at first I thought, no, because I'm a very friendly person and I'm very proactive about trying to smile at people and say hello when I'm at the dog park or the gym or just whenever it's appropriate. But I also think I'm a pretty strange guy and most men probably aren't. Not most men. I hate generalizing on here, but I think this one could have some truth to it. I just don't know if it's that drastic.
I don't know if it's that drastic either. It seems a little extreme, right? But at the same time, I feel like most boys as they grow up are not as comfortable with emotion, good or bad, like as women are. So they're not encouraged, even if you're happy, like maybe they're not encouraged to like be very expressive about it. It's like, okay, you're happy, but like quiet down, you know, even though it's not a bad thing, good or bad is kind of like but you know, just expressing in general.
I'll say two things to that. First, I was working out the other day, and a guy was at the far end of the gym, and I just happened to be looking in the mirror, and out of the corner of my eye, I saw something, and one of his friends had walked through the entrance, and he literally skipped over to his friend and then jumped into giving him a hug, and it just made me so happy.
I love that.
And I don't know if it made me happy because it was guys, like would I have a different reaction if it was two ladies, or probably because I just like seeing people be happy. Mm-hmm. But I really liked it, and so
it's not
kudos to them.
It's not common. I feel like if I saw that, I'd be like, oh, like you're doing something that's not really common.
Yeah.
That's nice.
It is nice.
Yeah.
The other thing I'll say, and we don't have to get into it on this episode because we get into it on so many other episodes, but yesterday, for example, I just had on not an agent, a commander from the Israeli Special Forces, and we had a good 20-minute segment just talking about, like, why is it that, guys? Why is that taboo there, you know, and just personal experiences with our guy friends and seeing how they do sort of stay level. It's a very weird thing, and this podcast fights it.
Cool.
And we'll actually, I do have one question on you around vulnerability, so we'll circle back to that in a little bit.
I'm here for it.
Fact or fiction? I'm going to say this one when you're not drinking in case it makes you laugh. In medieval Germany, it was believed the only cure for a toothache was to kiss a donkey.
Let's go fact.
Okay, cool.
How do we find out the answer?
We don't.
Oh. It just seems like something the medieval Germans would really be fond of.
It seems like something I could have seen people believe that.
Yeah.
I've heard stranger facts than that of like traditions and.
I mean, if it could have been a cow in India, you know, so if it could have been do you say a donkey?
A donkey in Germany.
So, yeah, sure, why not?
Last one is fact or fiction. This one I really do hope you know the answer to, or maybe can give us some context around it. Okay. There are over 300 different species of bacteria in our teeth.
There are over 700.
Holy cow.
Yeah, and they're starting to like sequence it.
And when people hear that word bacteria, that doesn't mean that's a bad thing, right? Isn't that some of that bacteria is good for us?
So, like, just like your gut, like, there is good bacteria in your mouth. There are things that are supposed to be there that, you know, kind of like, you know, police the area, keep it all nice and tidy, keep the area in a nice, healthy environment. The whole thing is just to keep the good and the bad bacteria in a balance where the good outweighs the bad. Things start happening when the bad starts to outweigh the good. And interestingly enough, none of us are born with the bacteria that causes cavities or causes gum disease. Somehow it's acquired.
Interesting.
They say usually through the mother, but not always, you know.
So not acquired by me doing or not doing something like either eating sweets while also not brushing my teeth, but it's genetics.
It can be genetics. It can be like, oh, my grandmother was babysitting me. When I was 2 years old, the pacifier dropped on the ground. She put it in her mouth to clean it off before giving it to me, and now I have the cavity bacteria.
You know how you get these memories that are just ingrained in your head? When I was in college, I was taking a nutrition class, and they showed a video about bad nutrition practices in the kitchen. And so there's a baby in its high chair, and mom is chopping up some meat, and then takes a towel and cleans up all the meat juice from the counter, and then she goes over to her baby and cleans burn off in its face. Oh, no. I'm watching this video thinking, no mother is doing this. There's no way.
There's some raw blood for you.
Right. and And it didn't help that it looked like real meat juice. It was like this thick liquid, so whatever. And that memory is, that came rushing back as you were talking.
The like TikTok thing where it's like, what video lives in your head rent free? It's like the most ridiculous.
Yeah.
Yeah.
All right, a real life scenario for you, and then we'll get into your your thoughts.
Okay.
I told you the story, but no one else has heard it. So I have a friend who I will let remain unnamed, and he came up to me in the dog park one night, and he said, "David, who do you go see for your dentist?" And I told him, and I asked why, and he's like, "Well, my tooth really hurts, and I don't know why." And just because I was curious, I said, "How often do you brush your teeth?" And he's like, "Maybe once a week, 2 times on the good weeks." And I said, "How often do you floss?" He's like, "Oh, well, we own floss."
That's a common answer.
Get attention. You know what the road to hell was paved with?
You bought it.
You bought it. And I asked him, I said, "So you don't go to the dentist, or you're just looking to switch? Are you blaming the pain on your dentist?" And he said, "No, I haven't been recently." And I said, "When did you go last?" And he's like, "Honestly, I don't remember. So probably over 10 years. And so I saw him again about a week or 2 later, and I asked him if he went to see my dentist or any dentist and how his mouth was feeling. And he said, "Well, actually, the pain went away completely, so I didn't go." What to you is like the most cringy part of that story? You're like, all right.
How do we narrow it down?
How do we pick one thing that would...
No, I mean, as a hygienist, hygiene is very important. Even brushing once a day, I'm kind of like, okay, people, I get it. However, the hygiene part for me, just because I see what happens when hygiene isn't there, and it gets bad real quick. So I don't want to say it's the most cringy part, but it's the part that I'm most concerned with. It's very frustrating in dentistry because like the doctors aren't doctors, they're dentists, right? Like even though they have a medical degree and they've studied the whole body, their opinion is not valued as much as a medical doctor, which yes and no, like I get it, but at the same time, like they're experts in their field, right? But a lot of times their advice isn't valued. A lot of the time, if people are not having pain, even if there's something pretty serious going on, if they're not having a symptomatic pain or whatever from it, they're less likely to treat it. Mm-hmm. They think of it as like, oh, well, I feel fine. Just like, oh, I had a cough, but now it's gone. I must be fine. It's different in your mouth. So it's just frustrating that we can see, a need of like, oh, you have some serious decay going on here. Your tooth is about to crumble or whatever. And they're just like, oh, well, feels fine. Like, we'll look back in 6 months. We'll see. I'm like, well, okay, well, it's your mouth.
It's funny because I have the opposite mindset where I go because, as I joked about earlier, I do like them to look good, but it's also, I never want to have mouth pain. Mm-hmm. I never want there to be a phase of my life where I'm just changing what I eat, or I have this, because what can you do for it? When I have a headache, I can take a nap. Mm-hmm. If my elbow hurts, I can slap some KT tape. But with my mouth, I feel like I have so little control over it that it's just, let's be preventative about this and just keep everything operating as it should.
Mm-hmm. And I love that you said preventative, because that's something that I love about dentistry, as opposed to all other medical things that are reactive. Really what we're trying to do is be preventative and be proactive and take care of things before it becomes a root canal or before it becomes an extraction. Like, if we have good hygiene and your gums are healthy, you're not really going to have issues. You're going to be good. And it's also something that, like, if you are taking good care of yourself, you get full body effects from, you're going to be healthier overall. So yeah, that's something I love. It's kind of become like a secret love of mine where I'm like, oh, I really like what I do. Yeah. Like, surprise.
No, that's good. Because when you love what you do, I feel like it helps it to not feel like work. Mm-hmm. And when you can actually enjoy what you're doing every day and you get some satisfaction from it, that probably has a domino effect on your mental health and even a ripple effect outside of work, So it's a good thing.
No, totally. Yeah. I stumbled on it for good reason, but it's kind of like, wow, I can't believe this happened, Yeah. But it worked out very well.
Have you, because you're in healthcare and because you're specifically in preventative healthcare, have you ever heard the parable of the picnic and the guy that went upstream?
No. Oh, yes. Yes, they told
Okay.
us about this. Yes.
I was gonna say there's no way you
yes.
haven't heard
yes,
that
yes,
one.
yes. No, totally. They like gave that to us some class along the way. They're like, "Oh, look at this, and this is what we're doing." Yeah.
There was. Have you ever heard of this book?
No.
Oh, it's really good.
Cool.
It's for those who can't see. Well, you can see that. Fair enough. I think I showed it on another episode too. It's called Upstream. It's by a guy named Dan Heath, and it starts out with that parable. That's the intro, and then it's essentially about 20 different case studies of how they took that concept of going upstream and fixed some sort of system. So there's a chapter about how they increased graduation rates for the Chicago public school system.
Cool.
There is a case study about decreasing, what's it called, domestic violence in a particular neighborhood. But if you like I think there's only one medical related one, but if you ever wanted to pick up a copy, it's a
Yeah.
good read. I'm reading it for the second time, if that
Oh,
says
cool.
anything.
Yeah, it does. It definitely does. I think that that's something just in general, like outside of healthcare, like we are not preventative enough. We're so much more reactive, and there's a lot of reasons for that. But the more proactive we can be, I think the better. It's just a matter of getting there.
One
But
of the
things
things
like that can help.
One of the things he highlights in the opening chapter is, did we forget that there's a fix? Because we are so busy. So we are, you wake up, you get your kids ready, you go to work. At work, they have this defined set of ways that you do things. And so you go and you do things. And then after work, you get your kids, make dinner, go to the gym. We're just so busy. And it's a concept called problem blindness, where almost like subconsciously we know it's there. This system should be better. More kids should be graduating school. More people should be going to the dentist, but we're so busy doing other things, we just sort of forget that there is a fix.
I think we're also like kind of just, I don't want to use the word programmed, but we're kind of just lulled into this routine. And so when you're in the routine, you're not really looking outside of the routine. It's just kind of monotonously going through. Just trying to be a little more mindful and like step outside of the routine can help a little bit too. Yeah.
Well, and he brings up a good point that the routine isn't necessarily bad. Because all that stuff that I just mentioned,
They're good
getting your kids
things.
to school, going to work, there is nothing bad in
No.
that schedule.
No, there's not.
And that's what makes upstream so ambiguous is which one is right. Neither. Both.
Right or wrong.
Right. Maybe don't even think about it in terms of just right or wrong.
Exactly.
It's more of, do you want to get to the dentist before your toothaches or after?
Exactly.
I'd rather be there before.
Same.
So that's just me.
I've had the symptoms. They're not good. Do it before.
The last one I'll just bring up is the gym I used to work at. There's this one gentleman who is very old, and the few teeth he had, they were grossly yellow, and they were pointing in different directions, and that was another motivation. I'm just like, I don't, even if they don't
feel it
even if they
sometimes.
don't look perfect, I want them there. I want them sort of wiped. I don't want them, like these. It almost had this color to it. It was just, it was bad.
He was like probably a cigarette smoker. Lots of staining.
It's funny because he is handicapped, and so he'd always park in the front of the gym, turn off his car window, and his windows would roll down a little bit, and then you just see a couple puffs of smoke coming out, and then he would come into the gym. So yes, he did smoke. Nailed it.
Alternative lifestyles, but hey, balance, I guess.
So a question I'll ask you is, let's say we do have those habits, right? For him, it was smoking. For me, I think I read or heard somewhere that drinking coffee is really bad for your teeth, but I'm never going to stop drinking coffee. I'd rather just brush right afterwards and hope for the best.
I'll give you tips. Don't do that.
Okay. So what if there's ever, this might be too big of a question because I just brought up two very different things, but like if you did have a patient like me who wants to take care of their teeth, but I'm also like, I'm not going to stop drinking coffee. What's a good fix for that? Just all the stuff we're going to get into eventually about flossing, mouthwash. We'll just cover that naturally.
Yeah.
Yeah.
So I'm also I'm very realistic. I'm also not going to give up coffee. I would never. I'm not going to give up red wine. I love it. And I don't expect other people to do that. That's crazy, right? Nobody cares about their teeth that much to deprive themselves, including me. So I don't expect other people to do that. The acidity of the coffee is, so if we think about your mouth as this little, happy ecosystem, anytime you eat or drink, you're probably going to lower the pH of your mouth, most likely, unless you're having I don't know, spinach, something very alkaline. Most things you're eating, you will lower that pH, which makes the environment a little less happy. So with every exposure, it's called an acid exposure. It takes 20 minutes for the pH to come back up. So let's say you have half of your coffee, you wait a half hour, you come back, you drink. So every sip is an exposure. So I would say drink your coffee. If you can, absolutely. If you can do it in a time frame, obviously don't chug it, but if you can do it in one sitting.
I'm just imagining someone chugging hot coffee.
Burning their esophagus.
Oh, that's so
My
funny.
hygienist said. It's second-degree burns.
Yes. What happened? I chug coffee 7 days a week.
I can no longer speak. Yeah, if you can do it more in that time frame rather than, I have a sip here, I go do something, I come back, an hour later, it helps. And then I would say don't brush right away, just because before that 20 to 30 minutes before that time period is up, it's still very acidic. So you could end up just spreading the acid all around, making things worse. It's the same thing with morning sickness with pregnant women. Just wait that 20 to 30 minutes. You can swish with water right away if you feel okay, swish, swish, swish. And then if you want to brush 20 to 30 minutes after, golden. And you don't even really need toothpaste. You can, but it's really just getting kind of in those staining areas, kind of along the gum line, I would say.
Yeah.
Between the teeth a little bit back there.
All right, let's get into it.
Okay.
What do you got for us?
Well, I'm just going to kind of piggyback on what I said in terms of, now that I've been educated in the dental hygiene world, I think of the mouth as this interesting environment where at first, before we got into the mouth, it was this very scientific, textbook. Here are the words, here are the pictures that go along with it. But then when you add in the visual, I feel that most people don't even really understand everything that's in and around the neck and head area. Tons of veins and arteries and nerves, and even your cheeks have a little fat pad. There's so much that's going on in this small area. Even when you're looking inside of your mouth, okay, you've got your hard palate, your soft palate, your tonsils back there. So much going on with your tongue. It's a lot. The whole floor of the mouth. There's a lot of muscles in there. Just a little fun fact, the tongue, per its size, it is the strongest muscle in the body, considering it's, not very large, but it's mighty.
How do they measure that, though? Because it would be proportional, right? My buddy Julian can squat 315 pounds.
Okay.
So
if
tongue, I'm trying to think
if his tongue were his quads, he could do 900. I don't know.
I'm picturing him, Julian. I'm picturing with you with tongue legs.
I honestly don't know. It's something that one of my professors just said one time, and we were like, "Oh wow!" Taking notes.
No, that's exactly what I was getting at, though.
Yeah.
It's so if his legs were tongue, then it would be something much higher than
Yes.
315.
Yes, definitely. I mean, your bite alone, I want to say, I'm trying to remember the exact figure. I want to say it could be up to 40,000 psi, 10,000 psi. Don't quote me. I'm gonna look that up. But your bite is very forceful. So
What's PSI stand for?
pounds per square inch.
Okay, sounds great.
Yeah. Put me on the spot. So basically, I'm just as a general, because I know people aren't super acquainted with everything that's happening in the mouth. Anything that's going to go wrong is because of the bad bacteria. So the bad bacteria, when they start outweighing the good, they start colonizing and forming this like very strong colony essentially of this like massive group of bacteria, and that's what we call plaque. So if you're familiar with the word plaque, it's a group of very smart bacteria. And I'll try to touch on that later, but they even outsmart the immune system. Like they're
The bacteria does.
yeah, it's crazy. It's really, and that's why you have to floss because your immune system can't kill the bacteria. So
Now, as we're looking at this picture, and if anyone wants to switch over to YouTube, it will all be there. Is the pink in this picture the bacteria? What's the pink and the blue and the gray? So pink being that, blue there, and then
so it's this like matrix essentially. Like the blue and the yellow, it's different types of bacteria. Like you have your different shapes. There's like the cocci and that like they grow in complexity, and there's like the little circle and the long one. Like there's different sort of bacteria. As they're sitting there, let's say undisturbed, we're not flossing. We floss once a month.
Tyler.
I don't know, no names. They're undisturbed. They're going to grow in complexity. What started as something like simple and pretty innocuous has now become like serious and complex, and it's gram negative, gram positive. It's the whole micro thing. But the gram negative bacteria, they survive without oxygen. So when they're like in the gums, deep, in there, they don't need oxygen. They're just eating your leftovers essentially, especially if it's like pasta or sugar, like a nice starchy kind of thing, nice simple sugar. They're just eating your leftovers, like thriving, chilling, like getting comfortable. So yeah, that's what we would like to avoid health-wise, because I even read this interesting I learned today as I was preparing.
Yes.
I loved it. I'm like, oh, this is so interesting. So I'm not someone who loves mouthwash. However, I do understand its place. So as I was looking at this picture and reading the site where it was coming from, they're saying even if you are, you're brushing, you're flossing, you do that, your gums and your teeth is 20% of the surface area of here. The other 80%, this third area over here where the things are coming out, the 80% of the surface area, they're all chilling. So it said, as soon as you're done brushing, flossing, 20% is clean. That 80% is now coming to re-inhabit the 20%.
No.
So I'm like, man, you do need mouthwash to a certain extent. If it's bad enough, if there's enough bacteria in there, you do need it. But my whole thing is that I think it is a much better treatment to not sanitize your mouth, to keep some good bacteria, or like it is always person by person. It really is. Sometimes it's like, okay, let's wipe you out and start over. Sometimes it really is like that. But I would say for the normal average person, you can clean your mouth in a way where you're not totally nuking the whole thing via mouthwash.
Because mouthwash doesn't know.
What's good or bad. It's just
right
across the board. It's all gone. Bye. So to me, like, I'm just like, well, is that necessary? Sometimes yes, sometimes no, person by person. But yeah, so there is a whole, it does really go beyond like the teeth and the gums, bacteria-wise. So when all that bacteria is going on in there, most of the time it's just gingivitis, which gingivitis is just inflammation around the gums. Your immune system responds to the bacteria. They're like, hey, something's going on. This bad bacteria is getting out of hand. We're alerted to it. We kind of come in and see what's going on. It's a whole process of what goes on, but that's essentially gingivitis, is your immune system, responding to the bacteria. Your gums will get inflamed as a response to try and fight it off. It doesn't really happen, which it's very interesting. The plaque, they send out this signal. It's a chemical signal that they send out, and it confuses the immune system, and then they don't do anything. And so it takes 3 days. And if the immune system doesn't, nothing happens, the things that were meant to kill the bacteria are now there to destroy what's going on in your mouth, like your gum tissue essentially, or your bone. So it's like what was meant for good is now it could hurt you, which that is crazy to me. I learned that today. I'm like, oh my gosh, I don't remember learning that, but I think that's crazy. So gingivitis, if it goes on long enough, you don't go to the dentist, it's been like 12 years, it could turn into gum disease. And when we say that, really all we're saying is that your bone is now affected. So the support that your teeth have is your bone, and the gum tissue facilitates that attachment. So we don't want the gums affected, that's your attachment. We don't want the bone affected because that's really your attachment. But when the bone becomes affected, it's gum disease, which is interesting. So there's varying levels of it, like slight, moderate, more severe. But an interesting fact is that 47.2% of adults over age 30 have some form of gum disease, which is called periodontal disease. And it increases with age just because with age you are going to lose bone. It's just a natural thing that happens. So 70% of adults 65 and older have gum disease
If
in some sort.
So if someone had it, would you tell them?
Sometimes yes, sometimes no. Like, it's interesting because especially for me, like sometimes I come in the middle and I was just temping and I just saw someone one day. I'm not going to be like, hey, you have gum disease. Like, I'm just seeing them for one day. Like, and I've worked in offices where I'm coming in and I'm doing the deep cleaning on them, which is typically when they have, it's like the initial, like, oh, you have gum disease, you need a deep cleaning. And I was just there that day and someone else kind of prescribed that for them. I come in and I'm like, they don't need this, but I do the cleaning.
Right.
Because I'm just there. But like if someone asks me and they have it, I'm like, oh yeah, like, do you have questions? Do you need to talk about it? Like, what do you need to know?
Increases with age 70% in adults 65 and older from the CDC.gov.
Mm-hmm. Yeah. That's interesting. So basically the ways that we go about looking at your bone and looking at your gums, we'll take the x-rays because we need to, that's the only, I mean, we're not Superman as much as we wish. That's the only way we can see the bone. So this is a healthy example of bone because it's right around where the crown is. Once you start getting like, that is a pretty severe amount of bone loss. And you can see there, like it starts to mess with the roots a little bit. That's when those teeth, that one's probably a little wiggly. We call it mobile. It's probably a little mobile.
Mobile.
Yeah, it's moving. And then we also measure the gums just to see how deep they are. They can measure deeply because of inflammation, or they can measure deeply because there's more going on. But that's essentially what we were looking for.
Can you go back one real quick?
Back above.
No, this one. That looks so painful. This is the bottom right one where the gum is in really bright red. It's not even real. It's a cartoon. I'm just like, ugh. No good.
There are people who can't even tolerate the measuring just because nothing has gone between. We measure like between the gum and the tooth, so we're getting inside. They can't even tolerate it because nothing's been in there for however long. And it is so inflamed that it is so sensitive that, yeah, they can't even tolerate it. And that's why for a lot of time, like if you have to get numb for your cleaning, it's because there's more going on.
What?
Mm-hmm.
Numbed for your cleaning?
It's usually not someone who's going in regularly. It's usually like, oh, I haven't been in for 10 years and no, I don't floss. And yeah, that sort of situation.
Okay.
Yeah, those are the fun ones, though. I like those ones. They're more interesting. But this is just a quick little thing, kind of just showing how bad things can get, but that there is still hope for them, in the sense that this person probably had a deep cleaning, I assume. They probably got numb for this. And that's just some tartar, which is when the plaque hardens. It's been sitting there for so long that it hardens to the tooth, so you're not able to brush it off. Only, we can get it off. So I assume they got numb. This gum tissue is not happy. But like, look, there's hope, things are, never, no one's ever really a lost cause. There's always hope. Like you can always, there's something that's called healthy on a reduced periodontum. And it's where there is like really severe bone loss, but someone is like, okay, well, I'm going to start flossing. I'm going to be like really good on my home care. I'm going to take care of things. And you can have healthy tissue even though you have bone loss. So like, not all is ever lost.
And for anyone that's looking at this is the same mouth. Because it's so different. I thought it was, the first time I saw it, it was comparing like a healthy mouth to a not healthy mouth. But that's the same person.
Yeah. Same person, like, maybe an hour or so after. Took some time getting in there, but like.
Only an hour?
Probably could be more. Those are just the front teeth.
Right.
And I just thought this picture over on the right, it was just an interesting kind of compare contrast. The picture that's in the middle, there's two kind of measurement instruments. The one on the left, it is just a healthy example. Like, okay, it's probably a 2 millimeter reading. Gum tissue is nice and pink. It's healthy. It's not swollen in any way. On the right, that's a crown that they're measuring. Something's probably going on in there. I don't know if there's like a root canal in there, but there's something going on in there. That one measures about an 8, but the gum tissue doesn't look bad. So that's kind of just my like, sometimes things look good, but when we measure, it's like, oh, okay, is there an x-ray we can look at? What's going on in here?
Yeah.
So I know a lot of people too, like their front teeth look really good and the back teeth don't. And then it's kind of like, well, things look fine. It's like, yeah, they look fine in the front, sort of thing. But like appearances can be deceiving sometimes.
Do you think are there people who brush their teeth regularly, but only the front ones because they're only thinking about?
There are people who floss their front teeth. And when they tell me that, I'm like, but the back ones are the ones that need it. What are you doing? And they're like, yeah, I know. These are the ones that show. Okay.
It's so funny to me because if you're going to do it already, why not just finish
do the whole
job?
thing? Yeah.
That's
Agreed.
so strange.
Agreed.
People are crazy.
Yeah. You kind of hear it all.
I mean, it doesn't surprise
Even
me.
though-
I worked in a gym for 10 years, and the things I saw and heard and experienced was just like the lack of logic sometimes.
Sometimes I'm just like, okay, I'm just waiting for what's next.
Right.
But yeah, no, people do. They don't know, not with brushing, but definitely with flossing. And something I really love, and it really is becoming more commonplace in dentistry because dentistry is more preventative, less reactive. They're trying to get away from this philosophy of like, oh, you have a cavity, let's fill it. Like they do want to prevent them from happening because that's ideal. I'm not going to read all of these, but this is just a cool graphic. They come from a lot of, higher institutions like Mayo Clinic or the CDC, or just Harvard has one, but it's essentially just a bunch of blurbs that are kind of connecting gum disease or any kind of thing going on in your mouth with other systemic things that could happen. Alzheimer's is one. Pregnant women and low birth term is another one. Diabetes, just things that happen when things in your mouth are not quite right.
Let me read this one.
Okay.
This one is crazy. Pregnant women with gum disease have only a 1 in 7 chance of giving birth to a healthy child of normal size.
They'll typically give birth early. So yeah, they're like preemies a lot of the time, which is interesting.
It's gum disease.
Because gum disease, well, it's like, why does that happen? They don't get into the why as much. It's like, well, what's going on? Why can't they get to full term? But yeah, that's something they stress a lot.
Bleeding gums increases your risk of premature death.
It's so harsh, but it's true.
Scare
You could
everyone
die
into
of so
flossing.
many. You could die of so many different conditions because the bacteria is all there. So it's true. We're gonna scare everyone this episode.
It's fine. We haven't done one of those yet.
The people need it. I came across a really interesting quote as I was preparing for this. this woman is a researcher, and I'm going to figure out her title, but she says every time you swallow, you are seeding your gastrointestinal tract, your GI, with bacteria, fungi, and viruses from your mouth. 140 billion per day to be exact, which how she even came to that number, I don't know. But that was just a very interesting statistic.
Tell me if you think this is her. Professor and chair of the Department of Ecosystem and Conservation Sciences at the University of Montana? No, because that's more... I might not be able to find it right.
Cass.
This one?
No. Look up Cass instead of Kara.
Oh, C-A...
C-A-S-S. At first I was like, is that a woman? I wonder.
Cass Nelson, lead SEO.
Because it was a strange title.
Health First Counseling.
This thing.
This one?
This that.
Ethnopharmacology.
Ethnopharmacology. Like, what is that? I'm like, this is not related to... But she studied the mouth for some reason.
It says she was studying ancient rainforest remedies. Do you know what she looks like? Is that her?
I think that's her.
Let's see. Masters of Science in Ethnopharmacology and how the jungles relate to medicine with women, men and women. Health consulting, medical communications. I'm the author of Heal Your Oral Microbiome. Yep, this is her.
That's the one.
And co-authored chapters in laboratory evaluations of integrative and functional medicine.
Yeah, I want to read her book. I came across her and I'm like, man, this is so interesting. And she's outside of the field, so that's even cooler. But that was just a cool little stat that she had brought to my attention. And then what I think is really cool is more people are kind of becoming kind of on like the probiotic, prebiotic, like happy gut sort of health thing. And your oral microbiome is very related to your gut microbiome. They share about 45% of the same species because, I mean, anything that's in your mouth, even if you're just swallowing spit, you know, it's you know, we're sharing everything. We're
I just did that as soon as you said it. It was like a subconscious. Let's get rid of some of this real quick.
we're one body though. Like we're gonna share stuff, even
right.
like because there is kind of the thought among a lot of people that especially your eyes and your mouth are separate from the rest of your body because there's eye doctors and dentists, you know, and it's all separate. But and insurance I think doesn't help that. But it's kind of we're starting to kind of like, hey, it's connected. So the oral cavity is the second most diverse biome in the body, second to the gut. The gut is much larger, obviously, but even like skin, you know, there's a lot of bacteria on your skin. The oral cavity is more diverse than that, which is interesting. And then I came across a cool study that was studying irritable bowel disease in 35 individuals as compared to healthy group of 24. And basically they just kind of compared spit. And they did a saliva test.
We lined up 59 people and had them all spit in some jars.
And then tested it.
Right.
And essentially what was going on was the people with the irritable bowel stuff, they were having oral manifestations. So they wanted to start studying it, and they found that their saliva did have higher amount of pathogenic bacteria, especially compared to the healthy people, that those figures and the bacteria were not there at those levels. So it's just like an interesting little study that showed that. And the studies really are coming around to the more connections, and I'll get into that in a minute, but it's wild. I follow a functional dentist on Instagram. He is Dr. Mark Buren. I read his book about sleep apnea and kind of just people who have sleep disordered things and related to clenching and grinding and the jaw. And it's all very interesting. It's kind of like, I spoke to an older hygienist one time and she was like, if you're going to do anything, study that, because that is like the emergent field. And I was like, okay, cool. So he's a very interesting dentist.
And his handle, real quick, can you go back to that slide?
Yeah.
In case you forget his last name, it's simply Ask the Dentist.
And his website is super informative. He's great. He is really, really wonderful. And this is his graphic that I took off of his website, but I cited you, Mark. Don't you worry. So essentially, he is just talking about the oral microbiome related to your gut and other systems, your GI tract, your immune system, your heart health. The endocrine system is related to diabetes, things that are affected by it's called dysbiosis, like an unhealthy oral environment. I don't want to say I scare my patients, but the bacteria.
I would disagree based off of some of the things we've talked about, but sure.
If I'm talking, because sometimes, I mean, like if someone's like, nah, I don't floss or whatever, I'm not like pushy, but I try to encourage.
Well, you told me though that who was the one, if you recall, it was a female patient and you sort of used almost like some reverse psychology into getting her to brush her teeth. Do you remember who? She was the one that came to you specifically to get her teeth whiter. And
It happens so often.
That's not unusual. That's not just like once a year. Do you recall what I'm talking? It was at the end. You had finished my cleaning, and it was when we were sort of wrapping up and heading out of the room. And you basically used reverse psychology. You didn't scare her, but you were like, oh, well, if you do this, your teeth will be whiter. And then she was like, I'll do that every time then.
She was like a 15-year-old girl. You know how, she might have even been like younger. She might have been 14, but she was a young girl. And she definitely needed to floss. It was like, sometimes you're going to be around puberty age, like hormones are changing. It's time to floss. It just happens with some of them. And so she needed to floss, but she was very concerned. She's like, should I whiten? And I was like, well, you could. I was like, plaque definitely has this kind of yellowish tint to it, which it does. I'm not lying. It does. So I was like, if you floss, you really will, your teeth will appear whiter and you don't even have to spend the money on whitening. And she was like, oh, that is such a good idea. She's like, I'm doing it.
That's good.
It's tricky, but kind of with the adults, I do kind of bring up a lot of what's going on in your mouth is very connected to your heart. It is very connected to your brain. I bring up Alzheimer's disease because the bacteria that's associated with gingivitis, the most strong correlation, it's P. gingivalis, is the bacteria that's most strongly associated with Alzheimer's disease. So it's kind of like, well, I mean, you can't. Oh no, it's not touchscreen.
It's not touchscreen.
But you can
you go up?
Yeah.
I'm just trying to remind myself overall gut health is what this one's talking about. I'm surprised to see anxiety and depression on here.
Me too, honestly. But I will say, we'll talk about it in a minute, but it is very connected to nervous system stuff, which I'm like, wow, that's so crazy.
Yeah.
But I mean, honestly, it's not a cut and dry kind of oh, well, start flossing, you're good. All your cares go out the window. We can't promise that.
Want to fix your marriage? Start flossing. They might want to kiss you again.
Hey.
It might not be. I don't want to make out with someone with bad breath all the time.
It's funny.
Saving marriages.
Hey.
One free pack of floss at a time.
It's not just dentistry that you get. It's a full scale. No, it's funny because I've had a husband come in and be like, my wife says I have bad breath. I'm kind of like, okay, well, you have a lot of plaque, so let's talk about it.
I have a funny story.
In a nice way.
I was raised very Christian, and I was part of a prayer group, and me and a bunch of guys would be a coffee shop every Friday, and one Friday, one of them comes in and says his prayer request is that he would have better breath. And I had to ask him. I was like, Luke,
do you
brush? Do you floss? Do you mouthwash? No.
Right.
And it made me think of this phrase that goes, God, choose your deity of choice and put that word there. But God helps those who helps themselves. So should we be praying about this, or should you be going home?
Like, cleanliness is next to godliness, like that whole thing. Oh, Luke.
God bless you, Luke. I hope you hear this one.
So this is the other half of his little graphic. He's very functional. Like, he does things that I'm kind of like, ooh, okay, like, I hear you, but I'm scared to try it. So his diet, you know, he recommends like a very mineral, veggie rich, low carb diet, high in protein. They like, you know, nice organic grass-fed beef, all that. Great. Mouth taping is kind of a newer concept. I've only heard a few patients that are like, I don't recommend it because I'm scared of it. And so I know how it might sound if you're like, what are you talking about? But essentially, mouth taping is a concept that people do when they go to sleep. They'll take a piece of tape that is, you know, like nicely kind of friendly, you know, it's not going to rip your skin off. But people will tape their lips as they go to sleep so that they don't mouth breathe and create dry mouth, which can create cavities. It's friendly tape.
Well, this is the only tape I have.
You don't want anything that's going to rip your skin off.
Or my beard.
Or your beard.
I'm just going to try this
This is not recommended.
I'm going to try this for 10 seconds.
But it's for like when you're sleeping.
But if I can't be comfortable with it awake, how am I going to go to sleep with it on?
That's a good question. I'm scared to try it myself. I like where we're going with this. Just pretend you're sleeping.
Well, it's not staying on, so that's
Okay.
problematic in and of itself.
I'm sure they have like some sort of, grade of adhesive that works for 8 hours. I don't know. I'm scared of it. But they highly recommend it. So, I'm like, okay, Mark. Obviously, brushing and flossing, you know, it's a good thing. He says do it 30 to 45 minutes after any starchy meals. I mean, if you can, that's great. It's the sugar and the simple carbs that will get you. So, but do wait that amount of time because it is the whole like pH, spread the acid around deal, which we don't want. Go in for your cleanings. Tongue scraping, which I do love. Because like I was saying, it's only the 20% that is your teeth and your gums. Your tongue is a very large reservoir of bacteria. And just like having it in there, it's not ideal. You know, if you can get the bacteria out, get it out. The like copper ones are the ones that are, I have one that has a brush on one side and then it's just a plastic scrape on the other. You don't need to go hard with it. It's not about pressure. The brush does that on its own. Just go as far back as is comfortable. And
Can you do it with floss? Or
I
do you have to
I
go
don't
get
think
a
it's,
tongue
yeah, I don't think
scraper?
it's, I don't even like doing it with my toothbrush.
I think that's the one thing you told me to do that I didn't follow up on.
Oh, have you been doing the whitening between the,
Yes, with the
Yeah.
with the floss.
you notice anything?
Not yet.
Yeah.
But it's only been, 2 weeks?
Yeah.
2.5?
Yeah.
So,
Yeah, it's still good.
yeah.
I was just a little like, I wonder if this will work. It should, because it's just the smallest little bit. Mark recommends ditching the mouthwash because it is very like antiseptic, gets rid of everything. And if you're not using an alcohol-free one, it will dry the mouth, and dry mouth can cause cavities. Not ideal.
And before you move off that, I did go and get the one that you told me to.
Yay!
So this is
Did you try it? Oh, not yet.
Oh, yeah, it's... And I'm using
Oh,
two
you just kept
bottles
the
at the same
plastic
time.
on. You kept the plastic on.
Yeah, like I said, I'm a strange person.
Oh, that's okay. You don't have to take it off. How do you like it?
I like the taste.
I do too.
It tastes like black licorice.
Yeah, it's interesting. I'm not really a licorice fan, but
I'll have to
It's
post a picture of
interesting.
it, but it's Oromir. How do you say that word?
Oromir.
And you recommended this one specifically because alcohol-free, sulfate-free, fluoride-free, vegan, cruelty-free, paraben-free, non-GMO, gluten-free, soy and corn-free.
It's a little extra,
There's nothing in it.
but beneficial things that you need. And okay, it is a little extra, but I came across that brand at TJ Maxx of all places. They actually have really good toothpaste and mouth, like they have good products there. And so I saw it there. It was less than $5, and I loved it. I'm like, okay, it's healthy. It's not totally nuking me. Like it's good. So if there are times where you're like, for whatever reason, things feel extra dirty, like go for the mouthwash, go for it, get the other 80%, you know?
I'm gonna send Luke a bottle. He's back in California, so and it was just his birthday, so I'm gonna send him a birthday gift and include a card that says, "I know you're against this, but on the days when you're praying for God to take away your halitosis, here's the answer to the
Try
prayer."
this. Go get a cleaning from your hygienist. You get 2 a year.
Oh, man.
Take advantage.
Yes, please.
So this says 1 to 3 minutes of oil pulling.
If I had coconut oil, I wish you told me. I would do this live right now for
okay.
60 seconds.
That would be fun.
Darn it.
You can do an experiment.
I will.
Yeah. You could like add a segment in. People have told me up to 20 minutes. Again, I've never oil pulled because the thought of like,
is it a teaspoon? Is it like as much?
It's like a tablespoon-ish.
It's a pretty good amount.
But it kind of like you start salivating and, you know, people love it. They're like, I feel so clean. It feels so, like, they love it. And I'm like, okay, great, do it. Like, I know that there's antifungal properties of coconut oil, antibacterial. Like, great. It's not hurting anything. If you like it and you feel clean and you want to do it after you brush, it's not going to hurt anything.
Right.
I also don't think they'd recommend it unless, I should look up some studies.
It's funny because I just try to keep a good diet. I brush, floss. I do have mouthwash, so I guess I'm against him. Sorry.
It's a better type.
The mouth tape, this tongue scraping, and the oil. Never heard of those 3 before.
The mouth taping scares me because I breathe through my mouth at night. So I'm like, okay, well, what if I can't breathe? And what if that wakes me up? I don't know. That part scares me. Tongue scraping is great. Do that after you've had coffee and then just see what comes off. It's like, oh my gosh.
I'm scared to do that after 14 years of drinking coffee and not doing that. Oh no.
I mean, yeah. I just included this little slide in here just because we're talking about like microbiome and stuff. So the dentist asked the dentist, Dr. Mark, he talks about common oral microbiome disruptors. Number 1 is pH. So any like acidic coffee, wine, even like a cheeseburger and a soda, pretty acidic, that will disrupt the biome. Diet, if you're eating a lot of carbs or eating a lot of sugar, obviously that does have an effect on what's going on. And I almost feel like, how sometimes in the body, like you do good things. Let's say you start eating a lot of like probiotic yogurt. The good bacteria starts to grow more because you're creating a healthy environment. If you're eating garbage all the time, that's how I kind of see like your microbiome won't respond to the garbage, or it will respond to the garbage, versus if you were putting good things in. So I feel like that's kind of the thing. You set the environment. If you build it, they will come.
Yeah.
Sort of thing.
Let me ask you a question on 3 of my habits.
Okay.
I'll start with the one I'm good at. Athletic greens. Take them 7 days a week.
Okay.
Do you know anything about those? Mm-mm. I've heard those have part of the reason I got them is because it has all the microbiomes. So
okay.
It's just an easy fix.
It's a supplement.
Yeah. Yeah. It's just a green powder. It almost just tastes free. So I just throw it in with my protein shake and call it a day. The one that I'm pretty good at, I probably do it 5 days a week, is eat just like a spoonful of kimchi. Mm-hmm. Yeah. I
like kimchi.
You can get it at Costco. Mm-hmm. It tastes delicious. It's like $13 and the thing it lasts me a good 2 months because I'm not eating a ton. It's just like I said, a fork stab, a pretty good amount and then eat that. The one I'm bad at, probably once every 10 days, and it's just because I forget, half a shot of apple cider vinegar. Mm-hmm. Mm-hmm.
I love apple cider vinegar, and I know like the whole shot is how people like to do it. It's just so acidic. But I'm like, oh, it's so acidic. If you can do it and like avoid your teeth, I mean, is it worse than alcohol? Probably not. But health-wise, I'm with you. Teeth-wise, I'm like, okay, just avoid your teeth as you take it. But I'm with it because apple cider vinegar is like it.
Why did you compare it to alcohol?
Because it's like another shot that you're taking. It's not good for you.
The apple cider vinegar.
Like I'm saying, like in terms of the acidity of it. What is the acidity of vodka?
We're going to find out. What is the acidity, oops, of, there we go. Thank you, Google. 4. Do you know what that means?
Yeah, so it's a chart of 7, 14. 7's the middle. Your saliva is 7.4. So anything below 7 is acidic.
Okay.
Anything above
8 to
7.
14 is non-acidic.
Above 7 is alkaline. So your saliva has buffers and stuff in it and protein. Like your saliva is chock full of stuff to keep it a little bit above 7 to be a protective factor. So, okay, now what's apple cider vinegar?
2 to 3.
Ooh.
So it's stronger. It's more acidic than vodka
Yeah.
by double almost,
Yeah.
depending on. It doesn't say.
Interesting. But
You brought up not sugar, soda. Mm-hmm. Was it more the soda or the burger that you were?
the soda, I mean,
Are
the
these
burger too.
acidic?
Probably slightly, but not
Like a
not a
Coke.
lot. I worked at an office. They had a hanging little poster, like a infographic thing, about different waters and the pH of different waters, like Dasani versus Fiji, and they had a range where some of them I'm like, this is acidic. What's going on here?
So you would want your water close to 7?
Yeah, and even like alkaline water is very good. I like alkaline water. It has a smooth taste to it.
All right, the most acidic water, 7 is natural,
I think that might have been the one.
whereas sports drinks and soda are 4. Dasani, Aquafina, Penta, all between 5 and 6. 7s are the Fijis, Core, Life Water. Oh, interesting. Guess what's on 7? Tap water. That's what I drink. I get the bottles out for the show because
It's fancy.
well, it's fancy, and because I'm inviting strangers into my house, so I just feel like having something closed and sealed is a little bit better.
True.
And it's fancy. That's
We take every opportunity to be fancy.
I'm drinking the most expensive water I can find for a reason.
True.
And this one really does taste good.
Is that the lime one?
Yeah.
Yeah, you like it.
That one's delicious.
Yeah.
And mineral water, it's funny because when I was restocking my unhealthy amount of bubbly waters this weekend, I did notice a mineral water, and I almost got some because of the labeling and just it looked, and for the show, like in case someone wanted one. But I didn't know what it was, and I didn't want to take the time to Google it.
That's mineral water.
Great.
But what is it?
But what is it? But like LaCroix and Waterloos, those aren't mineral
No,
waters, right?
it's sparkling water. So they just carbonate it.
What's the difference between this and like a LaCroix?
Those have crazy carbonation.
Actually, to be honest, that's why I got it.
I kind of like it too.
I heard there's a podcast where they were talking about so I'm a child in some ways, and I think it's really funny to belch loudly. And so I was listening to this podcast, and this guy was like, "If you want one that'll just like make you roar, get a Topo Chico." I had never heard of it, so then me and my buddy are in the grocery store, and I was like, "Dude, look,
That's
go
the
grab a
one.
case." Like I said, child in some ways, adult in
It's so
others.
carbonated.
It is.
Mineral water apparently just contains dissolved mineral salts, elements, or gases, which perhaps that's where some of the carbonation comes from. That's why it's so extra.
See,
Contains dissolved mineral salts, elements, or gases.
I think there you go.
I prefer it.
Maybe I'll start drinking more and see if there's a change. All right, back to Dr. Mark. No, the vagus nerve.
Almost. Okay. Well, the other things that Mark says is any disease, medication, or dry mouth will disrupt your pH, which is true. I mean, anytime, like in school when they were teaching us, like, oh, diabetes, like here are the implications of the disease. Here are the implications of the medications that they could take. Dry mouth, like all these things that could happen in the mouth. You could see effects. Someone told me the other day they had effects after COVID in her mouth. And I was like, really? What happened? Because I hadn't learned too much about that. And she said she had like the most pain. She's like, I don't really floss, but it was like extra. She's like the most painful bleeding gums. But she also had a tooth that she needed work done on when the pandemic happened. And so obviously she didn't do anything for it.
Oh, no.
So that tooth came out. But I think that might have been part of it. But she's like, yeah, then I got COVID, and basically I couldn't touch my gums without them bleeding. So there's like interesting things that happen as, you know, things get thrown off in another area. They kind of, your mouth can sometimes feel it too. This is just an interesting little tidbit that I thought was cool because it's just not something that is common knowledge. So the vagus nerve, it's also something that a lot of like health people are talking about because it does do so much. There's a left and a right side. It comes down kind of around the base of your neck. The vagus nerve works to maintain healthy heart rate and blood pressure, circulation, breathing, and many other things with other organs as well, including the heart, liver, your brain, your gut, blood vessels, etc. There are some implications with the mouth as well. Taste is sent via 3 cranial nerves, one of which is the vagus nerve. And it's also needed for the gag reflex, swallowing, and coughing. So all those things, you can just think about the vagus nerve. But it's an interesting thing. I mean, a lot of us now, I see it too with a lot of people that I see. There's just a lot of like hunching and a lot of like the neck that starts to kind of like that whole thing. So your head posture will affect where your jaw sits and obviously your spine. So all of those things could be affected just from how your resting state is. And when that does happen, the blood flow is restricted to the brain. So even just, you know, changing that, there will be some effects from that, right? Like if your brain isn't getting the blood or oxygen that it needs, something's going to happen. So the tongue posture, like where you allow your tongue to sit in its resting place, can help to correct this. So like, yes, you know, having good posture and kind of like tilting your neck back, but with your tongue, you want it to sit on the roof of your mouth with the tip of your tongue resting behind your 2 front teeth. It doesn't matter if your teeth are biting. It's more just letting your tongue rest. And it is kind of something you might have to train yourself to do it.
Resting on your 2 bottom teeth or top teeth?
Top teeth. You basically want it flat against the roof of your mouth.
Like a cobra.
Sure. I get that. But that can help to improve vagal tone, as they say, like kind of just the strength of the nerve.
Have you heard of tech neck? Mm-mm. A coworker threw out his back, and when he went to his physical therapist, I forget who he went to see first, they told him he had tech neck, and it's something...
Oh, tech neck. I get it. Yeah.
People are, and I notice when I'm looking down at my phone all day, it does have a strain on my neck. So sometimes, even though it looks weird, but I'm home, so no one can see me, is I'll be texting like this, and I'll have like... It's weird, but it makes me feel better.
No, I totally get it. I'm so worried about us in 30 years. We're all going to be like this and like barely able to move our little T-Rex arms. Like, we're going to be so gnarled up and like we're going to have to use the dictation.
That's not good. Because we have bag tongue posture and tech neck.
And tech neck.
I'm going to try to keep my tongue up there, though, because when we were talking about this before we started recording, I thought it was like on the base of your mouth, but no, you want it on the top, touching the 2 front teeth.
Kind of just resting back behind. Like, if they touch, it's okay. Don't, like, put pressure on the teeth because you can, like, move your teeth by putting pressure there over time. If you just let it rest behind them. I know, it's weird to think about.
I don't think about my tongue very often.
I mean, who does?
Only when I'm brushing, because I do give it a little love, just for like a couple seconds. I think about when I'm at the dentist.
Yeah.
I feel like it acts up there. I'm
There's
like,
so
can't you
many
just lay
times.
down?
Oh my gosh, I know that's my like nemesis. But you can't ever bring attention to it. Like you cannot ever say like, "Hey, relax your tongue," because as soon as you do, it's a weapon.
Right.
People are just like, "Oh, okay, I'll relax," and they're just like, "Oh."
Wait, what's their tongue like?
Like a fish out of water.
Oh, man.
There's so many times where I ask people something and they're like thinking about it for a good minute, and I'm like, I know you don't typically think about this, and they're just like, yeah, I have no idea. But things to be aware of. This is just another cool thing that I came across. I follow this dentist on Instagram. His name is Dr. Stephen Lin. He has he's another functional dentist. He has a ton of just like really cool, interesting things that, yes, he's a dentist, but it kind of goes beyond that. He does a lot with like sunlight and diet and a whole bunch of stuff. So this is one of his posts. It just says, the tongue connects via fascia line right to the toes. So he has a graphic that he has kind of just showing like the tongue and really the whole journey down to the toes. And he even includes that tongue posture guides core stability. And you can kind of see how that would be just based off of the illustration on the left. So it guides the stability through hips. And then in his caption and his explanation, he just goes even further, and he just says that improved tongue posture, which we were just talking about, the tongue sealed to the soft palate, which is further back behind the teeth, soft palate, hard palate teeth, will correlate to improved core support, spinal, hip, and leg strength. It's wild. The fact that your tongue via fascia is connected to your toes, that's mind-blowing. I think that's crazy.
You know, I hope that a bunch of young men hear this episode and all of them are just thinking about tongue posture. I was just talking about with a friend the other day, it seems like guys doing legs is becoming much more prevalent.
Well, because we gave you so much shit about it.
Possibly. That could be it.
Skipping leg day again.
Right. And now we're taking it back.
Yeah.
And then it's not just that they're doing legs. It's, we have 17 different tools that we bring to the gym with us on leg day.
Sure.
So I hope they all hear this. And now everyone's just like...
While you're working on legs, think about your tongue posture and your core stability, and it's like, bam, you're getting more workout than you even thought was possible.
Yeah. There's already enough cues for a squat as it is, but there's one more to think about. Where's your tongue?
You never thought. So this is just a really interesting tidbit that I saw firsthand, and she was a very interesting patient just because her mouth was pretty unique. So I thought I would just, it was pretty unique. I thought I'd include it. So if you are watching this, the x-ray that is over kind of just below all the writing, that's the right side of her mouth. And this back molar here, if you look at the bone level, so you can see that white bit that's by the roots. It's very low. Like that's a very low amount of bone. And you can even see between the roots how it's very dark in there. Not great, not a good situation. And even in her mouth, when I stuck my probe in there was definitely some not happy fluids in there. And she is taking very good care of her mouth. It's just, I think it was a deeper spot maybe. And it was an unhappy spot. And same on the other side. The amount of bone that she has is not ideal. She is an older woman. She's 69. The x-ray of the teeth that's in the middle there, if you follow along and you look at the roots of the teeth, that amount of bone level is, like, when I saw that x-ray, I was like, oh gosh, like a little alarmed. And if you look up towards the crown of the tooth, there is some white stuff that you can see between the teeth. That's bonding that a dentist had put there, I think she said a number of years ago, because they were trying to stabilize the teeth in some way and just give them a little more support. It's really just a Band-Aid. Like, she knows those teeth are not ideal. She knows, you know, she hears it every time she goes in. She's aware of it. And that's actually why she takes very good care of her mouth. So I was talking before about like you can kind of bounce back and you can be healthy. It's called healthy on a reduced periodontium. It just means that you do have bone loss, but your gums can be healthy, which kind of at this point, every little bit helps. She had really healthy gums. It's really what saved her and is continuing to save her because she has most of her teeth. It's just this back molar on her right side that she doesn't have and like wisdom teeth. But other than that, like she has them. And it was just interesting to me because her hygiene is so good. She flosses and she uses a water pick. And to me, like, that's why she has her teeth right now. And she's only 69. Like, she's got some years left, you know?
She does. She could be around for 20 more.
Yes, she could. So that was just like a really interesting case because it's not always that we see this amount of bone loss, but healthy gums. Yeah, she cares. And like, I always love when people care. Like, you care about your teeth.
Yeah.
I love it. Like, it's very encouraging because it's okay, I'm not fighting this battle alone. You care too. But yeah, that was just a cool little bit.
You mentioned just now a water pick. And when I only got one.
Yay!
So here's the thing.
Okay.
I only used it once.
Uh-huh.
But only because I made a giant mess.
I know.
There was water going all over the place.
I know.
So how do you use this thing? Yes, you closed your computer.
Let me explain.
I wasn't going to turn it on.
No, I know. So it's definitely the sort of thing that you have to like lean over the sink and do by feel. You can't just like look in the mirror and be like, oh, what am I doing here? It's totally by feel. Because you have the cordless option, you can hop in the shower and use it in there and go crazy. Right. And who cares? Because, you know.
How close do you want this part to your teeth?
So when I use mine, I start in the back up here and I put it in place and then I turn it on. So I put it right on the tooth, right exactly where I want to start, and then I turn it on and I keep my finger on that button the whole time because I'm going to eventually want to turn it off. Right. So I will just go around the gum line. I generally just do like the 2 molars, the 2 premolars, and then I'll turn it off. And you'll
just floss your front ones?
Well, I do it in stages. So I'll do this, I'll stop. I'll do this, I'll stop, I'll turn it off. And then what I do is I don't want to move around a lot. So I'll do like the cheek side of these teeth, and then I'll go to the inside of these teeth. Because you have to do the cheek side and the inside.
Right.
So I go cheek side, inside. Then I generally have to fill it back up. Then I'll do the other thing, cheek side, inside. And then I'll do the front.
How many days a week?
Do I water floss?
Yeah.
Right now, I'm doing it more often because my 2 front teeth are fake. I'm waiting. I have like 2 temporaries in right now, okay. And I'm waiting on the permanents. It's going to take a little while. So the temporaries that I have, it's 1 piece. So I can't floss between them.
Interesting.
So I can only use the water pick. So doing that right now. So I do it more frequently, but like I go through spurts. Like sometimes I really love it. Sometimes I'm like, I just want to use string. Depends.
I think I might just become the person that uses it in the shower.
Yeah.
Because then I'll still try to use good technique, but it just made such a mess.
I know.
And that's filmed it, so I could have like put it on at the end of this episode is like a little humorous 30 seconds of David making a mess in his
David's
bathroom.
attempt.
Yeah.
It is something that when I say like, oh, you can take it in the shower, people are like, oh, like okay, like that's exciting. And something I want to be better about telling people. I've told one person, and he was like, oh, I'm so glad you said that. Empty it out when you're done with it. Let it dry out. There's the little hose that's in there. Like, let it dry out between uses. Because my brother, God bless him, he doesn't have, like, ideal hygiene. You know, he's a boy. And I'm speaking about him. Everyone's an individual. However, Christmas time, I go home. He has the water pick that I bought him, and it's like filled with water, and it's like the whole tank is, I mean, we have minerals in our water, so the water is not always clear, but I'm like, this thing is yellow in here. Like, it's orange. Like, it was gross.
It wasn't like this where it was
no.
You could tell like it was just being used a day or two ago.
No. And
I
it
was
like,
yellow?
it was gross. And I was like, what are you doing with this? Like, this is the thing that's supposed to be keeping you clean, and it's dirty. So, like, what are you doing? And he's like, obviously he doesn't want to hear it from his sister, but, you know. But I was like, okay, well, if he's doing this and he thinks it's okay, that means other people are doing it and they think it's okay. So I just got to, like, remind myself to.
That's like the thing with the meat towel. Why would you spray your mouth with yellow or orange water?
And so I cleaned it when he wasn't around because I couldn't help myself. I, like, took the hose out of the inside and, like, ran vinegar and water through it. Like, yeah. So keep your water picks clean if you're using them.
I didn't think about emptying the tank, but also if I saw that the water was starting to change color, I would not use it.
I mean, most people would, right?
Not your brother. What's your brother's name?
John.
John
and Luke. Get them together and then keep them far apart. Here's what you need to do. Don't feed off each other, but...
Do they?
Well,
feed off each other?
Well, Luke and John don't know each other.
Huh?
Your friend Luke.
Oh, I thought you were saying like you had two siblings and one name was Luke and one was John. So I got very confused there for a minute.
No, Luke and John need to we'd have a group session with them and then be like, okay, do your things and like, you know, don't get ideas from each other.
I actually do want to have, if you know anyone, I don't even know what you would call this person, but someone who's a sort of a psychologist, but they analyze specifically dreams. So one of my guests has had the same dream for, I think he said, darn near a decade, with only slight variations in it. And as he told
Is it the only dream he would have?
I forget if I asked him that or not.
But it was just recurrent.
It was recurrent. And it's lucid, so you can control a lot of the factors of it. And sometimes he dies in it, sometimes he doesn't die. And he's like, every time I tell someone this, I've never met someone who has the same dream that consistently for that long.
Right.
And part of it had to do with water. And I was wondering if maybe he had some sort of trauma as a baby, like maybe he slipped underneath the water in the bathtub or something in a pool. And so I asked him if he ever talked to his mom about it, and he said no.
He should.
Why don't you just ask your
mom?
He
should, yeah.
She might be able to elaborate on this.
Yeah, that's so interesting. I gotta find out. I love dreams. I think they're so interesting.
Yeah.
And there was a hot minute where I was like, I'm gonna write down my dreams. I'm gonna keep a dream journal. It was like a week.
I did the exact same thing. Yeah.
But I was remembering them so much more vividly. Like, I don't really remember my dreams unless it's right before I wake up. I remember details. It was so vivid. Like, crazy, where I was like, whoa, what is happening? Just because I'm writing it down right away.
Yeah.
Even middle of the night.
Well, I'm reading the book Why We Sleep by Matthew Walker, and he does mention that first.
I started that.
Me too, and I loved it. I don't know why I haven't finished it.
Mine was a library book, and it went back. But
that's a valid excuse. I don't have that. It's right there.
Well, I also wasn't consistent with it while I had it, but it's interesting.
Did you get to the section where he was talking about how
Probably
your
not.
brain is it's not supposed to, but it doesn't retain dreams like it does memories during the day. And so that's why if you do care about your dreams, you should write them down or speak them into like a voice memo, because your brain is actually doing its job by dispositioning those memories throughout the day. And so by nighttime, you're like, I know I dreamt something last night, but I couldn't tell you a single aspect of it.
Right. Well, you're not really supposed to. We use 15% of our brain, but it shouldn't be devoted to dreams. You know, it's cool that we can remember them, but why should we devote brain space to dreams and remembering them? I mean, they're cool, but like if we're gonna use 80% of our brain, then I'd be like, yeah, sure, there's plenty of room, but with how it is right now, I'm like, I don't think so. I'd rather remember my garage code.
My garage.
I don't know.
My credit card number.
Yeah. Yes.
To floss my teeth.
Exactly.
Yeah.
Exactly.
So much of that too is just habit building. Like, because I don't even think about cleaning I mean, I do think about cleaning my teeth, but it's just an action. I wake up, I get the dog, I jump back in bed for like 30 minutes, and then after that, coffee, walk the dog, breakfast, and then that's when I brush is after that first meal. And that whole thing, I don't think about any of that. I just do
Routine. That is something that I have recently been trying to be like, okay, people, because I'm like, okay, you're not flossing. How come? Like, what do you like? Do you think there's like, why do you identify as why not? And it's usually either like,
Why do you identify?
well, like,
why do you identify as a non-flosser? An anti-flosser.
how come?
Anti-vax, anti-floss.
Some people are anti-floss. It's kind of wild. I'm like, okay. But it's usually either like I forget, which I'm like, what do you mean you forget? Like, but it is habit building.
Mm-hmm.
Like it's not part of the routine. They didn't grow up doing it. I never flossed until I went to hygiene school. Not once. I've never had a cavity. I've never had a dentist or a hygienist be like, hey, things are looking a little, you should really floss. Like no one's ever told me that. So all's well. And then I was starting hygiene school and I was kind of like, just the fact of starting school, like I should do this. Mm-hmm. And then I learned about everything and I was like, I am doing this. This is what's happening. But I get it. I'm always very understanding and I try to work with people and I try to like, okay, what's going to work for you? Because if you don't like the string, you're not going to use it. So, what do you like? Do you like the water pick? Do you like the little things? Do you like the little sticks? What do you?
Oh, you mean like these things?
Yes.
I love these things.
Yeah, people do. They're easy. They're convenient. I know.
There was a Shark Tank episode recent, though, that was dogging on them. Not dogging on them, but just how much landfill it creates.
Oh, my gosh. You see them all over the gas station, the ground. Yeah.
And so her solution, the product she brought onto the show, do you know the premise of Shark Tank? Mm-hmm. The product she brought on was essentially a floss pick that just evaporates. Like it just breaks down.
Immediately?
No,
or like how
so
soon?
you still throw it in the trash,
uh-huh.
but instead of like this piece of plastic just going wherever the rest of the trash goes, it just disintegrates into like dirt.
Wow.
Essentially. But it was like $1 a pick.
Mm.
I'm not going to
spend
pay
$30.
$30 a month for my floss.
Yeah, no. I wouldn't. Like, who would?
And I'm pretty sure that they didn't give her an investment, and 2 or 3 of them, it was specifically
for the cost.
Can you get your costs down?
Yeah.
Maybe by like 10 cents, and they're like, nope, people aren't going to get behind this.
Yeah. I mean, like, there are a few people who might care enough, like, okay, let's, protect the environment enough to do it, but long term, like, they might buy a pack, but I don't think they'd use it long term.
Well, that's why I want to get into
the water
pick, because that, I think, if you have, it was a little bit more expensive than I was anticipating it being. I think this one was $69 or $59.
Mm-hmm.
But if it feels good and it's more efficient and it helps make the earth a better place, then...
And once you have it, you have it. Like, I mean, and you can even get new tips. You can get a new tank on it. Like, I had one where I dropped the reservoir tank, and so it had cracked, so it started leaking. I bought a new one for $10.
There you go.
Like, easy. As soon as you have it, which is nice. So, yeah, I do love those. And they do a good job.
Outside of the obvious stuff we talked about, brushing, flossing, mouthwash, we sort of went both directions. You can or you can't. If you're going to do it, be conscious of the brand maybe. We talked about the water pick. Any other hacks that someone who is proactive about keeping their teeth and their mouth clean, or even other stuff we were talking about, the gut health stuff like the apple cider vinegar. I don't know. We went over a lot.
I do sometimes use a probiotic toothpaste. It's probiotic, and there's a newer kind of fluoride alternative. It's called hydroxyapatite. I don't think I talked about it with you because you don't really need it. But it's something where a lot of people will just have general sensitivity. It's usually sensitivity. Or if you just kind of want a more natural alternative to fluoride, hydroxyapatite is what your enamel is made out of. It's literally the science chemical equivalent of it. So it helps to strengthen the enamel, which can help to reduce sensitivity. And I like it just because, like, it's a good thing for your teeth. So that toothpaste is combined with I believe it's a probiotic. I use that sometimes just because I like the ingredients of it. It's nice and healthy.
in your opinion, do you think it is harder, more expensive, more time consuming to A, daily put 4 minutes into cleaning your teeth, or B, not doing anything, and then when you're 45 or whatever the age is, all of a sudden you have this problem you're trying to fix?
I have had so many patients who literally they're like, I've done nothing. And then one day I turned 45 and everything went to hell. And they're like, now I need 3 root canals and blah, blah, blah. I love that you said 4 minutes because it's the recommended 2 minutes to brush. Let's say 2 minutes to floss. Maybe it takes 2, like the more you do it, the faster you get at it. I just come from a very preventative place where it's like, hey, take care of this before it is a problem. Do the things. That's kind of, I don't know, like if you can prevent a flood, just from doing something very simple, like, I don't know, collecting. This isn't even like a relevant thing. If you can prevent a flood by building a gate, that's not a real thing, but
Right.
do it. It is habit building. You do have to have the proper motivation, but there are a lot of good reasons to do it. You know which side of the camp I'm on.
Better.
You look better.
You're
It's
gonna smell
whitening.
better.
Yeah.
You won't be praying to your deity to take away your bad breath.
People get desperate.
And I
It's
just
so funny.
I just feel I do a lot of things that make me feel good, and I think they help me feel good. Another one is like going in the sauna for 20 minutes every day.
Love a sauna.
I feel so refreshed after. But when you take care of your teeth, when you go to the gym, when you take care of your hair, like I feel like it just also helps you walk a little bit more confidently, and then do things maybe either at your job, hosting a podcast. I don't know what the thing is, but it's funny how if you have some goal that you're trying to accomplish in life, is there any chance that maybe you're not doing little things just to make yourself feel better and be more confident in yourself? I remember this funny story for you. I was at a networking event, and I had on a suit, and I went in the bathroom, and I'm taking a piss, and the guy next to me is like, man, you look so good. I wish I had the self-confidence to wear a suit, but, I'm just a piece of shit. And I'm like,
I was surprised he even said that to you. Like, he even admitted it.
I like to think I'm an open, like people
people
could
approach
me.
you.
I've had probably 50% of the guests that have come on the show so far have, before they walked out the front door, been like, not only did I not want to, I wasn't planning on telling you about this. In fact, I even had the conscious thought to not tell you, and then we got here, and that's what we talked about for 40 minutes.
That's awesome.
But yeah, it was funny because I told him, I was like, well, if you have the money, like you can go to whatever store, Nordstrom's Rack, and or what's the one I got? I forget. It doesn't matter. It cost me like $80. I was like, if you have $80, you can go get the suit.
And honestly, even if you're not feeling it before you put the suit on, you can at least, like, either the suit will give it to you or you can fake it because you're in a suit. Like,
right.
I kind of hate the phrase fake it till you make it, but there is some truth in it. Like, you can fake it and then you can become it.
Right.
You can.
Manifest destiny.
Exactly.
So yeah, no, I like that.
That is funny.
I have a quote for you. It's from your Instagram page. I wonder if you'll remember this one. I think you posted this back in like 2015. So
I'm not a poster, so.
No, you're not.
I'm not.
This one's by C.S. Lewis. Love anything, and your heart will be wrung and possibly broken. If you want to make sure of keeping it intact, you must give it to no one, not even an animal. Wrap it carefully round with hobbies and little luxuries. Avoid all entanglements. Lock it up safe in the casket or coffin of your selfishness. But in that casket, safe, dark, motionless, airless, it will change. It will become unbreakable, impenetrable, irredeemable. To love is to be vulnerable.
Love that quote.
Why?
It's so beautiful. It's so true. It's so true. Like, and I think I really do appreciate vulnerability in people because it's not commonplace, especially I feel with how popular social media is. Like, you can kind of say anything, but you don't have to be genuine about it. So yes, I really appreciate when people can be vulnerable, and You can't have anything if you don't have love. So it's just a beautiful thing. And it's so true.
If you're not, when I jotted down a thought that I had, that if you're not vulnerable, do you not even love yourself?
I think so. Yeah.
And
because you're not able to even get to that point.
Right.
Like, yeah. Yeah.
There's one friend in particular that I have brought up a couple of times now, partly because I wanted to hear this. And this is when I made a joke, sort of a half joke, half serious earlier, about that we're fighting the lack of vulnerability. What I meant by that is his brother died at 31 years old, 17 days before Christmas in 2021. And the kid was heartbroken, naturally. I could see it. The first time I saw him in person after that incident, he's a completely different guy. You could see like the life was sort of sucked out of him for a little bit. And so before I left for Austin, a year had passed, and I asked him if he had, talked to anyone about it. And he's like, well, that's who that was my go-to for when I talked to someone. And I asked him, why haven't you gone to anybody, your parents, a sibling, a friend, me, a counselor? Come over to my place before I leave for Austin, and we'll, you can talk about whatever's on your mind for 2 hours. And he said that's not how I was raised. The men in my family, we keep everything to ourselves. You suffer in silence, you grieve in silence. And I remember I got in my car that day and I cried the whole way home, because I was thinking, he's going through all this pain, and it's been a year since his brother's death. And when I asked him about it, he immediately teared up. And it's like, how much is it healed, if at all?
The wound is still very raw.
Yeah.
Yeah.
And for death, like, that one's rough. Like, when does it stop becoming raw? 2 years? 5? I don't know. But at the same time, I think that there's things we can do to help the wound start to heal. And I don't think keeping it to yourself is the solution, even if you are a big, tough, strong man.
Everybody has emotions. Everybody feels pain. It's just how much you want to acknowledge it. And I feel the more you acknowledge it, the more you're able to get it off of your chest and get it off of, you're able to relieve some of that tension that you feel. Even though it doesn't change anything, it changes your well-being, because you do carry that heaviness around with you. Even if it's, oh, well, I'm just going through my day. And I think it also will keep you from reaching potential. Like you were kind of saying about just these little habits of flossing and going in the sauna and doing these things that help you feel better, that brings you to a higher place at a natural, this is my everyday status, so that you are able to reach something that's higher, but you're already here. So it's not such a big step. If you're, in an unhealed place, that's a giant leap. It's much harder to get there. Yeah. So I feel like your potential. But it is hard, because I know a lot of people, men, women, a lot of people who it's just that's not my comfort zone, and that's really hard for me. And it's a struggle. It is. But I would say even if you are just having quiet time, and maybe it's you can speak to your brother even if he's not with you. You can still kind of mental exercise.
I haven't thought about that. Maybe even write him a letter,
yeah.
In a journal on your computer and in the notes on your phone, and maybe even just seeing if he was to just write everything he's felt over the last 15 months.
100%.
Seeing that in front of him might trigger some sort of...
I have written letters to people that I have never sent, but it is very cathartic.
Yeah.
Yeah. It helps. It does. Because you, like I said, you're releasing it out of yourself. You are grief is heavy, and you're only weighing yourself down. One of my best friends, she lost her dad a number of years ago, and she still carries it around with her. And I'm like, come on, come on, but it's her journey. But it's heavy, and it's very raw, and it's because of the lack of acknowledgement about how she feels and her thing with it. But
do you happen to know, if you don't mind saying, did she get counseling, or did she talk to you? Do you know if
she not consistently. She does have a therapist, but the thing is, she's the type that she'll have a therapist, but she won't talk about it with her. She'll talk about work. She'll talk about other stuff.
I caught one of my friends lying to their therapist. And I'm like, wait a second. This
You
is
can't
the
do
one
that.
person. Like, don't you go to them so you don't have to lie?
But like, does the therapist know? Like, it's like if you can lie to them and they don't know, it's like, well, no one can stop me now.
No one can stop me. I'm invincible. Oh my God.
It's so funny.
Our friends. This is good.
Well, everybody needs love. That's the moral of the story. And you got to be vulnerable. So, it's for the best. It's hard. Like, good things are always hard. That's the thing. Like, even trying to get people to floss, I'm like, no one's ever been like, ugh, I hate, like, yes, they hate it, but they're never like, ugh, I regret it, or I feel so bad after I do it. They're like, no, like, it's good. And, and the people who it becomes a habit, then they're like, oh, I could never go back. Like, this is, I can't,
Yeah.
Once you're there, that's your way of life.
If I miss a day, like, I think the last one I was drinking with friends or something, but I remember I didn't do my routine, and just missing it one day, plus you're also drinking, and like
Yeah.
you eat pizza or something, and
Yeah.
then the next day I was like, oh my God.
That fuzzy
My
feeling.
mouth is disgusting.
It gets real fuzzy in there.
Fuzzy. Yes, it does.
And it doesn't take long. A couple of days, like, I was wanting to look it up and I couldn't find it, and I couldn't remember like the exact days, but it's like, after a couple hours, there's like this stage of the bacterial progression. After like 2 days, it's at this stage. And then after a week, it's quick. Those suckers are busy.
Those suckers are busy.
Get
And
down
we're
to
not
business.
being busy.
Exactly.
All right, one more for you.
Okay.
This one is from Oriya, an Indian elder. It doesn't interest me what you do for a living. I want to know what you ache for. I want to know if you can sit with pain, mine or your own, without moving to hide it, fade it, or fix it. I want to know if you can be with joy, mine or your own. I want to know if you can be... Oh, fuck. Sorry. I want to know
Not a part of the quote.
I want to know if you can be alone with yourself, and if you truly like the company you keep in the empty moments.
I know exactly what that one is. I love, like, you picked the beautiful ones.
I love that one. We
Isn't
sort of
it-
already
isn't it
talked
great?
about it, but I do like the very end of that one. Can you be alone with yourself and enjoy the company that you're keeping in that moment?
Because it's so important that you are able, nobody's really able to sit with themselves. We have so much stimulation and so much, even if you're alone in your house, there's still a TV, you still have a computer, you still have a phone, there's still stimulation. People really don't shy away from that. It's much harder to just kind of like be.
Not a lot of stimulation going on in this room right now. 4 computers, 100 feet of lights. No.
I'm looking at the TV as I'm talking about it.
This is a 5th computer, technically. I like it, though.
I mean, but the first time I came down to Texas, I was working at a summer camp, and it was just their kind of rule that during the day, you put your phone in this room in a cubby, and it had your name on it, and nobody went in there. It was fine. But you just like left your phone in there so that you could, work. Crazy, crazy concept. It's like a bunch of high schoolers and college kids. We don't want you distracted. So we did that, but it really brought us all together. Like, there's so many instances where even I do it, where you're like kind of alone with someone and you're like, oh, it's kind of awkward. Like, you're going to scroll. It takes away so much potential for conversation or connection or any, like, even the smallest thing. I think a lot of moments are missed because of technology, and it's a way that we distract ourselves. If these things didn't exist, would we deal with the difficult things? Would we just like sit in our uncomfortability and get through it? Probably. But it's just something we have to choose since it's not the world we live in.
Yeah. When you think of your younger self, did you ever have moments where you couldn't be alone with yourself? Is that something that you've sort of always had, or is it something you grew into?
I spent a lot of time alone as a child. I did. And I'm kind of introverted, oddly enough. I am introverted.
I don't believe you.
I'm an extroverted introvert. Anytime I tell someone I'm an introvert, they're like, no, you're not. I'm like, look, I am. I'm an extroverted introvert. I love people. But at the end of the day, I'm like, I'm going home. I need me time. I need to kind of relax from all this stimulation. So yeah, I definitely did have a lot of time alone. I moved around a lot as a kid. I like moved from like different schools and different softball teams and things that I was a part of. I also grew up in church, and we like in my 8th grade year, the church that we were a part of, there was this whole big drama. So we left there, and then we never settled in anywhere else. So there's been a lot of points where I've been like uprooted very suddenly, and then I'm just like, okay, well, I'm the new girl again. So it's actually like more comfortable for me to be alone, which is not the norm. But I think it's helped me.
Yeah.
Yeah.
No, I think a lot of us are introverted, extroverted, depending on where, who, when. So I get it. But no, if you were just if I was to say just based off my interaction with you at the office and then here, you don't seem like it. But I'm like that too. I'm
Yeah.
a host a freaking podcast.
Right. Like
But,
it's
when
easy for you to talk
tonight,
to people.
If there have been days since I started this podcast, sorry, family and friends, that I've ignored calls from people because
Yeah.
after I'm a recruiter, so I'm interviewing people all day. Then you come over, and this is
You're still
fun,
interviewing people.
but I am still working in a sense. So as soon as you walk out that door, my brain sort of shuts down, and it's just like, thank God.
Totally. I mean, it's a lot to work I even had that thought. I'm like, man, to even have a podcast, like you work all day and then you have something to do after work. Like it's a lot of just mental energy of like, okay, I have to this is something I'm doing. Like I'm committed to it. And you've been doing it. It's not like you have one episode.
Yeah, there's 7 out.
Yeah.
I forget where we're at, but we're getting close to 20 recording. But the thing I say it close to every episode. I'm going to say it again because I really want people to, when I ask to give us a 5-star review on Spotify, to go onto Apple Podcasts and give us a 5-star review and just describe Jesus. Subscribe. It's only Monday. And to subscribe to the YouTube channel. It's because I want this podcast to get to the soldier who was overseas, accidentally killed a civilian, and came back home, and they're wrestling with that that grief and just those dark memories. This podcast is for the young person who came to America thinking that they were going to live the American dream, and instead they're navigating the American nightmare of racism and trying to get work because they're not a citizen. And the stories that the guests that have shared are so powerful that my motivation is no longer like, oh, this is David's little hobby. I treat this thing as if it is the biggest podcast in the world because I need those messages from Judd and Hidea and Mike to get to that soldier and to get to that young girl so that they can see the life they're living now and have a glimmer of hope. And that's only going to happen if people support us. So I'm not asking for money.
Yeah.
I'm just asking for 30 seconds of your time.
Hey.
Just go give us 5 stars real quick if you're listening to this. No big deal.
It's real quick.
Yeah.
Could save a life.
On that note, one of your favorites. So 3 questions left for you. These ones are pretty easy.
Okay.
My favorite quote on your entire page.
Cool.
If only our eyes saw souls instead of bodies, how very different our ideals of beauty would be.
So true. So true. Like, don't you wish that was a real thing, though?
Yeah.
Like, just to be able to, like, Clark Kent into somebody and be like, oh, man, I see you. But
We're all on the same team.
we are.
It's
we
like
are.
I was thinking about this at the dog park one day. Like, why is it the dogs can, like, get together and they're all different ages and colors and breeds, and this is like the most harmonious place on earth? What did the dogs figure out that the humans can't? They're just looking at each other's souls.
Yeah.
It's sort of silly, but it was just a random thought I had.
No,
while
I love it.
Watching him sniff some butts. It's like, why are they all so happy?
I have random thoughts like that often, so I get you.
No, that one was really nice.
It's true. It's so true. We need it.
I have, you have no idea who the next guest is going to be.
True.
They have no idea who you are.
True.
And yet, I want you to tell me a question you want me to ask them.
Oh, cool. That's so, I mean, it could be so many things. Wow, you should have prepped me for this.
Nope, I wanted it to be
On the
spontaneous.
spot. Well, okay, I'm just going to go with whatever my first thought was. My first thought is, I don't know if that applies to anything, but that was what my intuition told me.
Okay.
So that's what I'm going with.
You ready for yours?
Sure.
Let's say someone you love very much and you are in a situation where you are both at risk. What do you do? Who do you save?
It's hard to know, like, to not know what situation it is, or like, is it a child or is it a, like, there's so many factors, but it's so hard to say. Like, I am someone who puts others before myself, so I would likely try to save them, but I feel like they would try to save me. So it's like, how can you know what's happening without knowing what's happening?
Right.
But that's a good question. Who's your former guest?
So, and I wish I had asked his answer.
Mm-hmm. Yeah, you should.
And maybe I will. I might just call him or text. I'll call him. I don't want to do that over text.
Mm-hmm.
But this was the guy who was the Israeli Special Forces.
Oh, okay, cool.
Yeah.
Cool. Yeah, it's hard to, I wish he gave more details of, okay, you're in a movie theater and a fire breaks out. Like me some context. Right. That's okay, though. Yeah, I mean, if I know I'm going to die, I'm going to try to save somebody in the process. So, it is what it is. Do you want me to give my answer for my question?
Yeah.
It's a little weird, though. I don't know if it's podcast ready, especially for the dental episode. If you're Israeli Special Forces, okay, you've seen some shit. But mine is weird.
I mean, I could bring up a really weird thought I had in my head, and then maybe mine will be more weird that it will normalize yours a little bit. No, okay.
I don't think so. But I'll tell you, you can edit it or whatever. But you're familiar with what's it called when you have the night sleep paralysis.
Mm-hmm.
Okay, so I had kind of an encounter. It was like 22, 23, 22, 21 maybe. I was young 20s. I was not sleeping. I was awake. I was hanging out with my friend who lived down the street from me. It was like a super normal night. We smoked a little bit. That was normal for me. It wasn't anything crazy. I was fine when I got home, like not anything. I get home, get in bed, I go on Pinterest, just like winding down, and I'm just like laying in bed, and all of a sudden I like sense something, so I kind of like look. I don't even know if my door was open or shut. That's the thing I don't remember, but I like saw something come around the corner. It was this like dark entity, and it wasn't, it didn't have like a form or anything. It just was darkness. And I felt it like come over my bed, and it was like hovering over my bed. And obviously I'm scared. And then I felt it like come into me. And like my thoughts were not my own. And I was obviously very scared, and it was enjoying the fact that I was scared. And it kind of just, my head was buzzing. And the only thing obviously it wasn't English. It was something, but we were communicating, even though we weren't speaking the same language. And the only thing, like, it sounded like parcel tongue from Harry Potter.
I don't.
Oh, you don't know Harry Potter? Get out. It was just kind of like hissy, kind of like, look up parcel tongue. It's just kind of like a hissy kind of a darkness. It's like the language that the snake spoke in Harry Potter.
Okay.
And so, yeah, it was just kind of like taunting me, and it was enjoying the fact that I was scared, and my head was buzzing, and I felt I was trying to like get away from it, and I couldn't. And it went on for a while, and I was like, what am I supposed to do? Like, I didn't know what to do. And I wasn't, like, I was raised in church, but at that point I was very like, and but I prayed, and I was like, God, please help me. And it was like instant, where like the buzzing went away, the fear went away, and it was like instant like peace and calm, and like I was hysterically crying, and then it was like calm and just very polar opposites. But I was terrified. Like, that was some shit. And nothing like that has ever happened since. It was the weirdest thing.
What do you think it was?
I mean, I think it was like a dark energy. I don't know why it came. I don't know why I don't know. And like the purpose, like, why are you here? Mm-hmm. And especially to be in my house, my parents' house, like, it's a very good energy place. So I'm like, I hope I didn't ruin this for them. Like,
I hope you're not bringing something into my apartment.
Exactly. Well, no.
The sage up over here tonight.
This was
doing
years ago. No, don't do a seance. You'll bring it.
An anti-seance. I'm gonna bless
cleansing.
every door, every window.
No, this was the only time it ever happened. Like, that was a number of years ago. I don't know.
Even if you can't name it, though, you believe it happened.
Oh, yeah.
There was no mistake. You
Nope.
weren't dreaming. You
Nope.
weren't
I
blacked
was
out
awake.
drunk. You were
Nope.
you like you said you were hysterically crying.
Hysterically crying. Yeah. Like, it was the most real thing ever. As extra, not extraterrestrial, but like as outside of this world as it was the most real thing I've ever experienced here.
The internet has so much on it, but did you ever go down a rabbit hole just sort of Googling some keywords? And not by keywords, I mean, like dark energy, paralysis while I was awake. Did you ever try to see if anyone else had experienced it?
No, well, I've spoken to so many people who've experienced sleep paralysis, and I've seen like all the markers of like, okay, yep, I've heard this multiple times. I've heard this. Like, you all are telling me the same story. So like, to me, when things line up like that, I'm like, okay, there's clearly some commonality for a reason. But I never looked into it as someone being awake. I just kind of trusted my experience, and I was like, I know it happened. I'd be interested to see if anyone has written anything about it online, just as like like this happened to you too. Like, this is crazy. Maybe I will check into that. But I never had, because I was just like, I know what happened. Like, I know. Yeah. Yeah.
After that, did you go through a stint of like going back to church or doing anything? Did it change any of your religious habits or anything like that?
Not like immediately, but yes. Just because I know what happened, and I know what I felt in that moment, where I felt like the change, and the voice was gone, and the heaviness was gone, and the darkness was gone, and it was replaced with something. It wasn't just that the darkness had left. It was that there was then light and peace in its place. This is spiritual, and this is like I have connected with God in that way. And so, having that, yes, in a sense, but it wasn't immediate, because I have found God in places you wouldn't expect.
One thing, I have a guest coming on in a week, and I want to talk to her about, she always had a concept for a business idea, and until she microdosed some LSD, she didn't convince herself that she could do it.
Really?
So then she did that, and then started the business afterwards. So
Cool.
I want to get into the specifics of, was this every day, once a week? How long? How much? Where did you get it? But also, like, when you were in the middle of that experience, what was going on that when you came out on the other side,
That's
you
super
had
cool.
this confidence of like, yeah, I can do this.
Like,
no
of course I
problem.
can. Yeah.
Yeah.
Like, what changed your thought process?
Right.
That's cool. I'm interested to find out.
Yeah, I'll give you her name if you wanted to hone in on that
Okay, cool.
episode and see what she says. But
that's awesome.
I don't think she would have told me about it if she didn't want us to talk about it on the podcast. But yeah, no,
No, it's a secret.
I'm excited. I'm excited for everyone. But that one, it's part of the reason I'm excited because it's so foreign to me, because we were raised so sheltered that I didn't have my first drink until I was 21. I was like probably 22 or 23 the first time I got drunk. And then cigarettes, same thing, not until like mid-20s. Weed, very few instances, and they were all in my 20s. So microdosing LSD, I'm like, wow, she's such a sinner, but come on over. Let's talk. I'm kidding. I don't think that. I might do some after talking with her. We'll see.
We have very similar upbringings. That as soon as I went to college, I was just like, all bets are off. I'm a free woman. I was a little resentful of like, hey, hey, you sheltered me so much that you did me a disservice. I know why you were doing it, and I get it. I know the intention behind it, but I feel that was a disservice. And now I'm resentful about it. But we've moved beyond that.
You have.
Yeah.
That's good.
Yeah.
It almost makes me think of what's the city or the country in Europe that basically legalized all their drugs, and then afterwards the city.
Well,
did some
Amsterdam
other,
is very
maybe it was Amsterdam,
like the red district in Amsterdam.
and they saw that the use of drugs went down, and part of it was because it was safer. Because then instead of buying it from John Smith on the side corner of the dark alley, I can now just walk into Target and get something that we know is safe. But I think there's something to be said too for when you're doing something that your parents have always forbade you to do, you get this real big dopamine hit from it. A really big one.
Totally.
So if instead, like if I had kids, which I don't think I'm going to, but if I was to sit down David Jr. and just be like, listen, here's what alcohol is going to do to you. Here's what smoking is going to do to you. Make your own decisions. Do it safely. I'd prefer you not. Maybe do this stuff, play around with. If it's not this forbidden territory to wander through and we're just putting it out there, like, it's not going to be as exciting.
It's true. I mean, European kids that are drinking wine with dinner at 15 are not excited to like go to the club, and you know what I mean? It's not the same tantalizing, oh my gosh, let's go get drunk.
Right.
It's not, it's true. For the most part. I mean, you know, I kind of worry a little, or I'm like, let's not legalize everything. Let's not go crazy, you know, like we don't need people shooting up heroin and then going grocery shopping. I'm scared of that. That would be a scary world, but like, you know, just
shooting up heroin and then going grocery shopping.
Would that happen? No.
Is that what heroin users do after they take a nice shot at it?
Typically, no. But that would be a scary world to me, like where I'm all about moderation. I don't know how I feel about that because I feel like it would lower productivity. But I get it. I get that it would be less. But I'm like, let's hold on.
I don't think there's a one size fits all. I think there's a lot of systems that could be tweaked a little bit, though.
Yeah, that's a good approach. Because there's not.
I am surprised that weed is still illegal in some places. I'm like, really, marijuana? Can we just get like in 2023?
To me, I'm like, well, y'all made it illegal for a reason. Like you saw what could happen if people. But right now, what I don't like is how they're going very heavy THC and like making it as strong as they can so that people get the most effect from it. That's not how it was intended. So you're losing health benefits that with the CBD is there. And then you're just kind of like going crazy with it. I'm like, let's make it less synthetic. Like, so what if you're not getting super high? Like, at least you're getting, I don't know, to me, I'm just so naturally based that I'm like, let's make it more healthy and
I remember one time I was given this was back in my early 20s when I was still very ignorant to so much, and I was given my roommate at the time, Michael, a lot of shit for smoking weed every day. That he would take, and he smoked a lot, so he had his bong, and he would take it as soon as he woke up. He'd eat some breakfast, have another hit before he left for work, get home, take some more, go to the gym, get home, smoke some more. So I was getting a shit for it, and he fired back, and he was like, you're telling me I'm addicted to my weed? You have so much caffeine, like you have a crutch too. Why don't you get off your crutch for a minute, bro? And so we made a challenge that we both would go cold turkey.
Whoa.
And then whoever caved first would, it was something small, like $100, you know, or something like that. So I remember on day 3, 4, and 5, I think it was, those headaches, it wasn't
real.
day 1.
Yeah.
It crept in day 2, and around day 3, it was so bad my boss sent me home as a trainer at the time, and he was like, you're going to hurt one of your clients.
Oh my God. Caffeine is real.
And so one day, I get to like day 17.
Oh, wow.
Or
This went on
something
for
like
a
that.
while,
Yep.
yeah.
And I had to go home for something, but I had a very structured routine, and I broke the structure, and I walked through the front door, and Michael was sitting on the couch getting high, and I'm like, hey, you lost. I
Yeah.
got you. And he was like, yeah, I actually only made it to day 5. I was like, what? And he was like, well, you were doing so good, and you got past the withdrawal phase, and you seemed like you sort of liked that you weren't taking caffeine anymore, so I just let it lie.
Just kind of like encouraged you. Oh, that's so funny.
I have a couple of friends who are in AA, and they said especially with the new people, same thing with alcohol, because the first couple days, first couple weeks, part of the hardest part is even just sleeping at night, because they become so reliant on it that usually you can't get to sleep. You start sweating a lot. You'll start seeing your shaking, and so those are you want to get rid of the withdrawal so bad, and you know, for better or for worse, probably for worse, that if you can just get your hands on a drink, but then they're also trying to get away from the drink.
Right.
It's like this,
Right.
you know.
I literally have friends that are not able to sleep unless they smoke, which I'm like, okay, I guess we're here, like, you know, but to me, I'm like, okay, let's go for a walk. Let's make sure we've exercised a lot throughout the day, and like you're tired so that you can just go to bed and like not think, kind of thing. I don't know. You also have to, because it can be very psychological, so you kind of have to take your brain out of it and like make your body so tired that you won't think.
You do. You almost have to like set your alarm early, set yourself up for success at night. Because, well, part of the reason I think it's so hard for us to sleep is because it takes, if you're looking at screens, whenever your dopamine, not your dopamine, I think it's not melatonin either, maybe serotonin. Let's go with it. Serotonin. Right now, my serotonin would be kicking in because of the sun setting.
Yeah.
But because we have these screens,
lights and,
it delays it by 90 minutes.
Really?
So if we happen to turn all of this off right now,
it would still be 90 minutes.
we would start feeling tired around 9:40. Wow. But so many of us are watching TV up until when you go to sleep, so that no wonder you're tossing and turning for the first 45 minutes to an hour and a half.
And I really was like, no, like I still get good sleep, but like how can you? How can you? It's impossible. Like the blue light is inhibiting the melatonin from being released for sure. And I'm like, well, like blue light no, I don't know.
No to the blue light glasses?
I mean, yes, but like I still think they're not perfect. It's not as good as being like under the stars and in the absolute darkness where, you know, it's like, okay, yes, we should go to bed. Because it's dark, you know, like cave people. Where they're just like, oh, we're in the dark. Those Neanderthal.
The hunter-gatherers?
Them. They might be offended if they knew I referred to them as that.
Well, they probably don't speak English, but...
I was thinking about a gesture, but...
This is not on video. There's no camera over there. What was the gesture? Oh my god.
But, you know, like a more natural setting will allow for sleep. Like, that's obviously better.
In Why We Sleep, one of the studies they conducted was they somehow, just through sensors, I think, but they had 2 people in a cave for like a 72-hour period, and they were able to track when they woke
Oh, yes,
up.
I did read that part. I did read that.
And
that
they
was
still
interesting.
went to bed at nighttime.
Yes, that was interesting.
Yeah.
Like their circadian rhythm was still prompting them to, that was cool. I should pick that back up. I'm going to see if I can get the library.
Did you get to the part about the country somewhere in Europe where they still take naps, like to this day? And so what they did was for 4 years, I think it's 10 years. For 10 years, they took a group of, let's say like 300 people, and they took away their naps. And all of them, heart disease went up, blood pressure went up, anxiety, depression, all the stuff we were talking about. It all went up, and it made me think, like,
naps and flossing.
That could be universal. We could go back to a model, even in the U.S., that wouldn't be that hard, where if you work an 8 to 5 job, instead you work 7 to 11, you get a 2-hour break to go eat, sleep. It doesn't have to be a long nap. 20 minutes, I think, is what the book recommends.
Yeah.
And then back to work by 1.
Yeah. I would love it. I always want a nap sometime midday. I'm like, ugh, I'm tired of this.
Can you sleep when the sun's up?
Only if I'm like sick or like insanely sleep deprived. Generally, no. But my room is a cave of sorts. So I don't have any windows in my room. So it's really nice.
Oh.
So I could sleep in there.
Huh.
It's lovely. I wake up, I'm like, what time is it?
There's no windows.
Because it's off the garage, and then upstairs is, but yeah, I don't mind it.
A windowless room.
It's perfect for sleeping.
This one, I felt this place is a little exposed because you can see everything. There's 2 of these floor-to-ceiling windows in the bedroom too. So if the light's on and anyone's just out in that section of the parking garage, you can see everything.
Yeah.
So it's like when needed.
Yeah.
Close the blinds.
I hate that. That's
not good.
well, I'm I'm big on my privacy, so I would 100% try to figure out, even if it's like some sort of plastic that you can put on that's a one-way where the light can still come in, but I don't know, maybe you might like it.
Have you seen the things where it's the lights where you can set them to start turning on at 5:30 a.m., let's say?
I want to buy one. I was thinking about it today. I want to buy one so badly. The Philips one that I want was out of stock, but yes.
How much?
Like 200 something.
That's not bad.
Not at all. I would love it.
Especially for your room.
I know. Well, I know. And it's like this beautiful orange glow, and it gradually, and you can put whatever settings you want, and I really want one.
That'd be nice.
Yeah.
Well, my buddy Jake, I've never walked into a bedroom and thought, oh, this is a really peaceful bedroom. He has those pink rocks.
The Himalayan
he
salt.
has some of those. He has
Plants.
He has a lot of plants. He has a lot of tapestry. There's a tapestry on each wall. He put up a very just simple string of white Christmas lights that go around the perimeter of the room.
It can be really soothing to have white lights. I don't know what it is, but it can be really nice. Yeah. It's important though. I think to me, having a space, to me it's the bedroom, but a space that is just very calm, I think it does a lot for mental health. Just helping you settle down, wind down from the day. It's important. Even if it's not the bedroom, just a space where you're able to have that.
Even like a chair?
Sure. So, a space that's your own, whether you're somewhere where you're able to relax and detox from the day, you know? Yeah, I mean, a chair would be great because it could be a reading chair, a meditation chair, whatever.
Well, part of the reason I asked that specifically is because that chair, I really only sit in it once a day at night. It's for about an hour the dog is on my lap, and that's our one time of the day that we watch TV. Don't really sit in the chair any other time.
Yeah.
So it's a very special hour for, he gets to fall asleep on Dad's lap. I get to think about nothing for a little bit.
You need that.
I look forward to it.
Hey, we all, even if it's as small as sitting in a chair and having time, that's a thing. If you're looking forward to it, it's, you know what I mean?
There's something
it's
about
important.
Having him on my lap too that change, because if I was just watching TV, it'd still be nice, it'd still be relaxing. But when he cuddles up and then puts his head on my belly and then he starts snoring, I'm just